Legislature. We have a public hearing, and so I'd like to open the public hearing now, which is the Tompkins County Legislature's public hearing on proposed changes to Agricultural District Number 1, and we will hear comments from anyone who's here for the public hearing. Monica Roth. Hi, Monica, good to see you.
Hi, good to see you and everyone. Thank you. I'm Monica Roth with Cornell Cooperative Extension, Tompkins County, and speaking on behalf of the Ag and Farmland Protection Board. I just wanted to review the process that we went through so everyone knows what is involved in the review of an ag district. It begins 300 days before the anniversary date, which the anniversary date of the district is April 28th. So we've already passed the anniversary date because of these various matters that we're dealing with. We are a month behind. But that being said, we started the process on time and we followed the state's recommendations. We published a public notice. After that, all of the municipalities are notified that the district is under review. In this case, we have 5 municipalities involved. We have Lansing, Groton, Dryden, Caroline, and parts of Ithaca and Danby. And maybe that is 6 municipalities, isn't it? So at any rate, we've reached out to each of the municipalities. I counted up, I attended 24 different meetings, whether it was a town ag committee or a town planning committee or a town board. And we really work to get engagement because the important part of review is to look at what are the land use patterns in a town and how is agriculture and the town's goals, how are those two things working together? Are there some conflicts that we need to address? Are there some, changes that need to be made, some land taken out of the district? During the review, this is the only time that we can actually take land out of an agriculture district. So that's why we can only do it every 8 years. So that's why we spend the extra time and effort to go through the review process and meet with the towns and get their recommendations. We also get input from landowners. And if landowners that were targeted possibly for removal, if they wanted to stay in the district, we generally honor those requests and keep them in the district. So I think my 3 minutes might be almost up. I am joined luckily by my colleague Mila Fournier, who will also speak on the process that we've been going through.
Thank you, Monica. Others, Mila, you want to speak on the public hearing?
Sure. So just to give a quick summary, what we're looking at is after doing the review, after meeting with all of the municipalities and the landowners and sending out mailers and all sorts of stuff, to summarize, we are going to be adding 369.58 acres to Ag District Number 1, primarily in Groton. There's a large piece of property there that is being put into ag use. And then there's another property in Lansing, 61 acres being added. In total, though, we'll be removing 1,739 acres from Ag District 1. And those are various areas throughout all the different towns. The one town that's getting the most taken out is Dryden. That one did not have, we've not really taken that stuff out of it before. So it was the first time to really look at some of those spaces there. And what we're doing is we're not so much, we're responding. We're being not proactive in terms of taking things out. We're being responsive to the kinds of land use patterns that have been put into place over the last 8 years. So, there are areas where an entire space got put into, say, new housing, or is being taken out of farming, or is forest land that's not really appropriate for farming. So we're being responsive to what's actually out there. And so now the ag district is going to be more accurately reflective of what is actually being out there used as farming.
All right, thank you, Mila. Anyone else on the public hearing?
John Fleming is here too. He's the chair of the Ag and Farmland Board, if he needs to unmute.
John?
He's coming.
Hi, John.
Yeah, maybe he's.
John, you are unmuted, so.
He's probably on his tractor.
Maybe a little
He
technical
was going to
difficulty.
use his phone and be probably, taking a break from plowing.
And I think he's gone now.
Yeah. Oh, well.
All right, well, thank you very much. Anybody else would like to speak on the public hearing? Thank you, Monica. Thank you, Mila, giving us a little more information about what changes were happening. We appreciate it.
Okay. Thank you.
If there's no one else, we'll close the public hearing at this time and open the regular meeting of the Tompkins County Legislature on Tuesday, May 19th, 2020. And you all please join me in the Pledge of Allegiance to the flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Roll call of members.
Amanda Champion,
Here.
Deborah Dawson,
Here.
Henry Grandison,
Here.
Rich John,
Here.
Anna Kellis,
Here.
Anna, you, thank you.
Dave Klein,
Here.
Ann Corman,
Present.
Mike Lane,
Here.
Dave McKenna,
Here.
Glenn Morey,
Here.
Martha Robertson,
Here.
Mike Sigler,
Here.
Shauna Black,
Here.
Leslyn McBean Clairborne,
Present.
14 members present.
Thank you all very much. Good to see everyone again. Presentation of proclamations, petitions, communications, and notices. I have a couple of proclamations to read. This is a proclamation for Older Americans Month. Whereas the COVID-19 pandemic has created many challenges for older adults and highlighted fear, worry, and vulnerabilities, let us also recognize it has demonstrated how critical and essential our network of older volunteers are. And whereas this year's Older Americans Month theme is Make Your Mark, which perfectly captures the role of older adults in Tompkins County that they are making during this time. And whereas Tompkins County recognizes older adult volunteers who put themselves at risk to provide critical services to older adults in their homes and to our community every day. And whereas in Tompkins County, there are over 6,800 volunteers age 55 and above who contribute almost 3.6 million hours of service annually at an economic value of more than $100 million. Their volunteerism is expressed in their time, experience, and talents to benefit family, peers, and neighbors every day. And whereas Tompkins County recognizes older volunteer efforts in providing essential services during this pandemic as a result of Matilda's Law by delivering meals, groceries, supplies, and medication, providing transportation to critical medical appointments, and making phone calls to older adults to combat social isolation. And whereas Tompkins County recognizes the importance of the physical, mental, social, and emotional well-being of its citizens, and that we as a community are stronger when people of all ages, abilities, and backgrounds are included and encouraged to make their mark through actions, passion, commitments, perseverance. Now, therefore, I, Leslyn McBean Clairborne, Chair of the Tompkins County Legislature, do hereby proclaim May 2020 as Older Americans Month and urge Tompkins County residents to recognize older adults and the people who serve them as essential and valuable members of our community. Hear, hear. And the second proclamation is, pardon?
Lisa Monroe is here from Office for the Aging. I don't know if you want to recognize
Oh.
her for that. No, she's up there.
Oh, hi, Lisa Monroe.
Hi, Leslyn.
Thank you for being present, for
Yes,
accepting the Older
Yeah.
Americans Month proclamation. It's great to see you.
thank you. I appreciate it. And I just want to say thanks because, I feel like during this pandemic, there's been so much focus on the vulnerability, which I'm having a hard time saying too. So the ability of older adults that we really lose sight of the vitality, the experience and value of them. And, older volunteers and our older workforce are really the backbone of some critical services that help us provide this to people in need. So thank you. I appreciate it.
Well, thank you very much for your kind words, and thank you for being there and for all the work you and the staff of the Tompkins County Office for the Aging continues to do in support of our older residents. So thank you.
Thank you.
And our other proclamation is in recognition of Asian and Pacific Islander American Heritage Month in Tompkins County. And I want to thank Legislator Henry Granison for drafting this proclamation and having it brought forward. Whereas in 1992, the month of May was officially designated Asian Pacific American Heritage Month after years of efforts by politicians, including Representatives Frank Hurton and Norman Y. Mineta, and Senators Daniel Inouye and Spark Matsunaga. And whereas May was designated to observe two significant dates in Asian American history: the arrival of the first Japanese immigrant in the United States on May 7th, 1843, and the completion of the Transcontinental Railroad on May 10th, 1869, on which the majority of workers who laid its western portion were Chinese immigrants. And whereas on May 1st, 2009, President Obama issued a presidential proclamation that recalled the challenges that Asian Americans and Pacific Islanders faced and celebrated their great significant contributions to our society. And whereas Tompkins County has been home to people of Asian descent for over 100 years, and whereas Tompkins County has been a center of resettlement for refugees from Southeast Asia for more than 4 decades. And whereas with the outbreak of the COVID-19 pandemic, over 1,700 instances of anti-Asian harassment and violence in the United States, including in Tompkins County, have been reported to community organizations since March 19, 2020. And whereas anti-Asian harassment and violence are part of the broader and continuing history of racism against minority groups in the United States. And whereas with the passing of scholar, teacher, and activist Susie Gage, Ithaca College and Tompkins County recently and tragically lost one of its most committed advocates for Asian Americans and for broader social and racial justice. Now, therefore, I, Leslyn McBean Clairborne, Chair of the Tompkins County Legislature, do hereby proclaim May 2020 as Asian and Pacific Islander American Heritage Month in Tompkins County, and that together with our entire community, join in celebration and recognition of the Asian and Pacific Islander American community ensure the safety of Asian American and other racial minorities, and declare that racism has no place in our community, and that Tompkins County acknowledges, and I want to repeat, acknowledges the efforts of Suji Gage to achieve these goals. And I do want to dedicate this proclamation not just to Asian and Pacific Islander Heritage Month in Tompkins County, but to Suji, who was a dear friend to my family and to me. So thank you, Henry, for bringing this forward. Thank you, legislators, for your contributions as well and your support. Very, very fitting. And Derek, are you here to receive this?
Yes, I guess I am.
Thank you.
Yeah, so thank you so much for making the time in this space, and thank you, Henry, for inviting this resolution. We really appreciate it, and particularly in light of all of the work that Suji had done. This marks a particularly special and meaningful day for us. So thank you so much.
Thank you, Derek. And without doubt, our support, as always, to all our residents, not just here, but throughout the country, who are Asian Americans and of Asian descent. Know that the Tompkins County Legislature, they were all cheering, are in very strong support of your contributions and of you, and we will not condone any form of bias and discrimination against anyone in our community who is of Asian descent in regards to this pandemic or at any time. So thank you for being here, and please convey our sentiments to everyone else in the community. So thank you. You can clap now. Thank you. Moving on, are there any other correspondence, Kathy, that we should be aware of? No other correspondence or communications. Privilege of the floor. Any executive sessions tonight? Any special announcements? Any executive session? Jason, are you there?
I'm
You
here.
didn't tell me about any. Do we need?
I don't have anything, Leslie. Thank you.
Thank you very much. Privilege of the floor for the public. Is there any public who would like to address the legislature? No? Well, we're nimble, so just in case there was some technical difficulties or something, and you do come on at some point, I will do my best to acknowledge you. I can't acknowledge everyone because we need to go on with our meeting, but we'll do our best because we know with technology, sometimes things do happen. Municipal official, Duxon, is great to see you. And please introduce me to your face stylist, because I need to get my hair and stuff taken care of, and your face is looking fantastic. Duxon Nugent, City Council Representative, 2nd Ward, and my City Council Rep. Thank you for being here, Duxon.
Thank you. Yeah, I don't have to do much. I've never come close to growing it out this long before. Thanks so much, by the way, for doing that proclamation. I've not personally been affected by it, but some of my constituents are Burmese immigrants, and in that community there have been some incidents, unfortunately, and it seems to be often women who get harassed.
Duxon, I'm sorry to interrupt you, but it would be really helpful if you speak a little closer to the mic because it's hard to hear you.
Sorry, yeah, I'm wearing headphones, but a lot of my constituents are Burmese immigrants, and that community has certainly gotten hit with some discriminatory actions. So it's important to get the word out that it's not acceptable behavior. So thanks for that.
Thank you.
I don't have a ton to report. We council met at the beginning of the month. I guess something notable, and the county has done this too, but we are going to release some of the CDBG funding slated for coronavirus, remediation for emergency rental assistance for 0 to 60% AMI households, and our portion will help about 50 families. INHS is going to handle those applications. I'm told the marketing plan will start next Monday, and with the target date for the actual program taking applications on June 1st. So we have yet to pass that money, but my understanding is that IRA is loading that money early so that when we do approve it, and I expect that we will, that INHS can just continue distributing it without any interruption. We had a long discussion about, you may have already gotten emails about 5G. And so we had, at the city level, we have a permitting process for installing transmitters on city right of way. And Verizon has plans to do just that this fall, some new 5G equipment. So a design process has to be gone through. And so we approved moving that forward. We still have to approve any design guidelines that City Hall comes up with. But we're moving forward with that. It was almost unanimous. Most of us follow the science on this and are comfortable with having this technology. It's, for my part, an additional broadband option when we only have one real provider in Spectrum. Verizon does have a home wireless program that is price competitive with Spectrum cable. So I think it'll be a good addition. And the only other thing is that there is a PEDC talked about a pretty significant rezoning, downzoning, if you want to call it that, in the Cherish District by the waterfront. That's coming to council next month. Basically trying to reflect the intent of the waterfront neighborhood working group and the kind of neighborhood that they wanted to build there. So that'll be debated and discussed next month. Yes, one other note is that trash tags are required again in the city of Ithaca. So when you take your trash out this week, starting this week, you have to pay again, and they are at all your grocery stores.
All right, thank you, Duxon. Questions to Duxon? Anna?
Yeah. Or actually, it's just a comment, I guess. Checking in. Can you hear me? Am I unmuted?
That's the other thing. Again, people speak a little louder into your microphones, please.
Can you hear me now?
Oh, yes.
Okay. So we are having a discussion here that happens every 10 years on redistricting, and it's a really complicated situation, particularly given census issues and how that will impact the information coming back. And so we have been through the GO committee that Amanda is chairing. She's been doing a Herculean effort trying to get information through that. And I was just curious if the city is following that conversation, because the development that has happened in the city might impact, representation needed at the city level. And we're considering a whole bunch of options of the length of the next term to make sure that we address representation of the city. So I was curious if you guys have had that discussion internally, if you have any input on that, if you are part of that conversation.
I'm not, but Amanda wrote City Hall and Council, and I saw that email, and thanks for reminding me to follow up, because I don't know. I didn't want to speak out of turn, so I didn't respond to it, but I do want to find out what our plans are, because it is really important. Most of the development in the city is in my ward. I expect it to geographically shrink, and to maintain the population balance. So yeah, I'm personally very interested in that as well.
Awesome.
So I'll find out.
That would be great. I would love to hear as a city rep.
Okay. Thank you, Anna. Other questions for Duxon? Mike Lane, and then Martha Robertson.
Hi, Duxon. Interested in your comment about the waterfront rezoning. And I can't say that I'm up to date on all of that, but I worry a lot about our waterfront areas becoming the purview of the well-heeled. And I'm wondering what's being looked at as far as having waterfront access rather than just a lot of expensive apartments, for example, along the waterfront.
Yeah, so there is a public right of way, and well, it won't all be expensive apartments. The first project that's going up is Vicino's Art House project, which is well over close to 200 units of affordable housing, maybe closer to 150, but a significant chunk of affordable housing will be one of the first things to be built there. And it's actually that project that kicked off this reevaluation of the zoning there. You know, my counterpart George and some of the other members of City Hall thought that it wasn't in the spirit of what the waterfront neighborhood group had come up with, which includes visual and physical access to the waterfront. And so some of the proposed changes include limiting the maximum length of buildings, limiting the maximum footprint of buildings, the footprint of the buildings on the lot as a percentage, requiring green space, and kind of the issues that you're getting at in terms of public, both visual and physical access to that water.
Thanks. Is there any discussion about a resort, for example?
There's no resort, but John Gutridge and his partners have a project for some, not quite a hotel, but some lodging in another portion of that area.
That's something for years we've thought we needed in Tompkins County, was a lake access resort. Thank you, Duxon.
Thank you, Mike. Martha?
Thank you, Leslin. Hi, Duxon. I guess I'm confused. I missed one of your words. Did you say the zoning is on the Cherry Street area, or sort of the waterfront by the golf course?
No, the Cherry, I mean, you know, we call it the waterfront, but it's the flood control channel in the Cherry Street district. These are properties near the new Cherry Arts Theater or Ports of New York and stuff like that.
Okay, right. When you said mentioned Art House, I thought, okay, you're not talking about the City Harbor neighborhood. So that's,
no, Vicino's project there is called Art House. It is
right.
ostensibly targeted towards artists, but it's open to all people who fit the income needs.
Okay, all right. Yeah, thanks. That was all I had. Thank you.
Duxon, I have a quick follow-up for you. You mentioned as of this week, people have to return to putting trash tags on their trash now. Is it the same thing happening for parking meters, or that hasn't been, do we now have to pay? That was a question that I received, if people have to pay for parking, or you all haven't spoken about that.
No, parking is still suspended. Paying for parking is still suspended at this time. It's a huge hit on us though, so I expect that we're going to restore that soon too. But for
Wonderful.
now, not paying.
Thank you. Please give the love to all the people who park downtown to the city of Ithaca. We really appreciate it.
Absolutely.
Anything else for Duxon? As always, Duxon, thank you for joining us and bringing us information.
Thank you.
Take care.
Good seeing y'all.
All right. A privilege of the floor for legislators. And legislators, I want to recognize that we also have joining us tonight, Dr. Marty Stallone from Cayuga Medical Center. We have a resolution that's not on the agenda that we'll have to add to the agenda, and then we'll talk about it. And I'd like to move that up a little early so Marty doesn't have to be subjected to sitting through our entire meeting. We love him and we definitely don't want to put him through that.
Thank you.
Lest he will require the services of his own facility when we're done. So privilege of the floor for legislators. Anyone has something pressing they need to say? Rich John?
I'm happy to delay until after Dr. Stallone, if that's helpful.
No, just go ahead.
All right, I have two matters I just wanted to talk about of a personal nature. Putting that up for a moment. I reported in January that my sister put her hat in the ring for mayor of Baltimore. And that Democratic primary is coming up June 2nd. And I wanted to report that in the latest poll, she was tied for first. So if there's anybody in our community that knows my sister, please send her some positive energy. There's still a ton of candidates in the race. It could go any way, but she's really run a credible campaign and it's been very exciting. And then I had one other personal matter I wanted to mention. My daughter, Julia, graduated from graduate school yesterday. She got a master's of arts in education and is primed to now be a teacher. I'm very proud of her and the work she did, especially in this spring semester where she had to do her student teaching suddenly online. And you can imagine how difficult that is. She had been rotating through 3 different schools and she was on her 3rd school and suddenly had to connect and deal with her students remotely. And she got through it. And I think she's just done a wonderful job, which we had a nice celebration for her yesterday, but of course it's not quite the same as a graduation with all your friends and the celebratory aspect of it. I would suggest it would be a really good thing if you know somebody who's a senior or graduating from some program, that you do make a special effort to reach out to them and just tell them congratulations and what a great job they did. I'm afraid people will slip through the cracks, and these graduates deserve lots of love and attention as well. So I put that out there. Thank you, everybody.
Thank you, Rich. Congrats to Mary and to your daughter as well. Annie, then Michaeline.
Thank you. So I just want to address that Memorial Day is coming up this weekend, a little bit earlier in May than usual, but it is Memorial Weekend. And I just wanted to just put a heartfelt thank you and memorial out to all the veterans who have fallen, and another thank you and memorial to the veterans who we've lost through this pandemic. So I know for some folks it's hard because we won't be able to do parades, but there are other important memorials that are going on in small groups of 10 or less. I've heard several going on, and flags are being put out to the graves. So thank you for everybody who has worked on that.
Thank you, Annie. Michaeline?
I just really wanted to thank Henry Granison and you, Leslin, for that really nice proclamation, particularly about Asian Americans and Pacific Islanders. We've been seeing some programs the past couple of weeks about their heritage and some of the unfortunate ways they've been treated in the past by Americans, including the internment of Japanese Americans, including, as was brought up, about the almost slave labor of the Asian American, particularly the Chinese, for the building of the railroad from the West. It was the Irish that mostly did it from the East, and they were discriminated against too, but they weren't treated the same way. They were treated pretty bad, the Chinese and other Asian Americans that came over. We need to think about half of the world, which is Asian American, maybe more than half of the world, Indian Americans, and Vietnamese Americans, all of the ones that have come over here to be part of our community. I look back in history and I'm kind of proud of the fact that Cornell University started accepting and sponsoring certainly Chinese Americans, very early on in the 1800s to come to its school here. And at the time of the Boxer Rebellion in China, which was about the European countries mainly and America trying to force China to allow the sale of opium to its people. As awful as that sounds now, that's what was happening. And when the government was taken over basically by the European nations and America, they demanded reparations from the Chinese. The one good thing was the share of the reparations that came to America was targeted for the education of Chinese to come to America. And some of that came to Cornell University. So I just really think it's a good time for us to reflect on all of this. And thank you again for that proclamation.
Thank you, Mike. Can always count on you for some good history. Thank you. Anna Kellis and Martha Robertson.
Yeah, thank you, Annie and Henry and Lesland. There's been a lot of heart here, and actually, Rich, I wanted to thank you too, because that was really sweet, and happy to support your family. So thank you, everyone. I wanted to just note, there's been a lot of conversation about healthcare and what community health means in the context of COVID and infectious disease spread. And so I have organized a town hall tomorrow night at 7:30 tomorrow night. It'll be streamed live on Channel 13 with Dr. Jamie Lair, and Dr. Jeff Snedeker, and we have also constitutional lawyer and human rights activist Kathleen Bergen, and myself. And so I just wanted to share that conversation was going to be happening. Again, sort of the context of community health and what that means in the era of COVID. So anybody who wants to watch that, please tune in, Channel 13, and it will also be streamed live on YouTube, and there's a Facebook event, and I'll share it with all of you as well.
Thank you, Anna. Martha, where'd you go? Here you are.
I'm here. Hey, thanks everybody. About the graduation, Rich, I had a niece and a nephew graduate this past 2 weeks, and they had online ceremonies, which were wonderful and creative and not the same, but it did mean more people actually more family members from a distance could participate. In particular, this past Saturday night, and it's online, there was a fantastic hour-long session for the class of 2020 based on high school students, hosted by LeBron James. President Barack Obama spoke, but mostly it was the kids, and I really recommend it if anybody wants to see how creative this generation can be. But that wasn't my main topic. I wanted to make sure folks knew what was happening at the federal level with state and local aid. We've got 2 bills that are kind of front and center right now. The House of Representatives passed what's called the HEROES Act, top line number $3 trillion. That would include $1 trillion for state and local governments. Tom Reed sent us a press release, I think yesterday, about another bill called the SMART Act. These are all clever acronyms that mean something. That's got a companion bill in the Senate as well. It's bipartisan and bicameral for $500 billion. So there are differences, of course, between the two. The main difference as far as state and local government aid is that it's a far lower number on the SMART Act, the Tom Reed bill. So in any case, neither of them is going to pass. In particular, state and local aid is not going to pass unless there's really a groundswell of support. And I hate to say it, New York residents were already being represented well. Our delegation is unanimous in support of state and local aid. We need, like Aunt Millie in Tennessee, to call her member of Congress and her senators. We need Uncle George in Texas. We need people in Colorado, Montana, Virginia. So I really would encourage everybody to think about anybody you can contact, tell them to call. The number is 202-224-3121. Very easy, 202-224-3121. You can ask for your senator or your member of Congress, and that's the switchboard number. They'll get you to that office. They literally count calls. You don't have to be eloquent. You don't have to know a whole lot of stuff. You just have to say, we need the federal government to keep my county from laying off nurses and teachers and firefighters. Please pass aid for state and local governments. That's a really simple message, really important that people from all around the country make those phone calls. We expect the bill, whatever bill, to be hammered out. And if anything passes, it'll probably be late May, early June. So we have a week or two to try to get people to call. Thanks very much.
Thank you, Martha. That is super, super important. I'm actually going to repeat that number, 202-224-3121. We need everybody making those phone calls. You know, folks are concerned about summer camps not being open. What are caregivers going to do? After school programs, so many other things. And unless our cities and counties and other municipalities get funding and aid from the federal government, we are not going to be able to do those things. So please pick up the phone and make those phone calls. 202-224-3121. Yes, I know it sounds like a salesperson, but it's extremely important.
Thank you, Leslie. I didn't mean people shouldn't also call Tom Reed. Senators Gillibrand and Schumer to thank them. Thanks Tom Reed too, but we really need to see it as large as possible. Thanks very much, Leslie.
Yeah, we certainly will be. I want to very quickly just take this opportunity to also recognize, because I have a very, very special middle schooler who's graduating from middle school and moving on to high school. And I know, I was looking forward to graduation and I feel a little cheated. And so we did tune in to the Saturday night 2020 special. I know for a lot of them, it's just been so hard, especially our high school seniors. But I also want to recognize the hard work that our middle schoolers do. So big ups to Indira Clairborne. Most of you embraced her here at this legislature. I know how many nights she was here doing homework in the back room with Mike Sigler's daughter. And so many other middle schoolers. And I also want to give a special shout out to Sarah Blankstein, who is Suji's daughter and Indira's best friend, who's also graduating from middle school and moving up to high school levels. So kudos to all our middle schoolers graduating, all our high schoolers graduating, and to all the teachers and counselors and everyone who helped them push through in this whatever atmosphere we're in right now. So thank you all very, very much for the acknowledgement of our graduates. Under special topic of presentation, I'm actually going to move up and ask for Shauna to add the resolution to the agenda. We need 10 votes to add it to the agenda. And I'm going to ask at this time for Jason and Dr. Stallone to join us for that conversation on the special topics or presentation, so that, like I said earlier, Marty doesn't have to sit through the rest of it with us. So Shauna?
Thank you, Leslyn. I would like to move resolution ID 9351, and there is a revised version in everyone's email. Appropriation from contingent fund to purchase a Rionix Encompass MDX workstation to enhance COVID-19 surveillance testing in Tompkins County and the Southern Tier region.
May I have someone second that? Seconded by Amanda. Thank you very much.
That's to add the resolution.
This is just to add the resolution. So roll call to add the resolution to the agenda. You can unmute yourself, so we'll move to it quickly.
Amanda Champion,
Yes.
Deborah Dawson,
Yes.
Henry Grandison,
Yes.
Rich John,
Yes.
Anna Kellis,
Yes.
Ann Klein,
Yes.
Ann Corman,
Yes.
Mike Lane,
Yes.
Dave McKenna,
Yes.
Glenn Maury,
Yes.
Martha Robertson,
Yes.
Mike Ziegler,
Yes.
Shauna Black,
Yes.
Leslyn McBean Clairborne,
Yes.
14 ayes, 0 no's.
Thank you all for adding this to the agenda. It's on the agenda, and if it's okay with you all, we will take it up at this point. I'm not going to do a lot of talking about it, and so I'll to ask our county administrator and our CEO of TU Health Systems, Dr. Stallone, for it. Jason?
Sure. Thank you, Leslyn. Thank you, Legislature. So I'll start briefly, and then I'll let kind of Dr. Stallone give a little bit of an overview of everything. But basically, late last week, Dr. Stallone reached out to us as well as the city to talk about enhancing and improving and increasing the capacity of our local ability to process samples samples for COVID-19 testing. As you know, thanks to QD Health Systems, who stood up a testing site, a sampling site over at the Ithaca Mall when no one was really doing it at the beginning of March, has really expanded capacity and has really put us on the board in terms of not only this county, but this region's ability to manage testing and do it well. Having recently visited the site and getting tested myself, I can attest it's a pleasurable experience by the staff. The process or the procedure is not pleasurable. The staff were wonderful. But nonetheless, with testing becoming a broader range, more folks fitting within the criteria to be able to do more testing. Testing is a critical piece of surveilling the community for disease movement. The ability to process those samples is critical, and purchasing more machines to process those samples is a key component to it. This resolution includes us purchasing one piece of equipment from Rheonics, which is a local company. I'll let Dr. Sloan talk about its capability. And basically, we've done some research. We feel that this it's not 100%, nothing's 100% until you submit it, but likely to be FEMA reimbursable under our application, which would mean that 75%, as of it is today, 75% of the cost would be covered by the federal government, most likely 12.5% covered by the state, and a 12.5% local share, which is just about under $7,000 for us. That's not a lot of money considering its capacity and what it could do to improve it. There's been a lot of talk federally about the federal stimulus package possibly expanding federal coverage to 100%. Even if it doesn't, it's not a huge investment for us for what it could do. And I guess maybe I'll turn it over to Marty to talk a little bit about its capabilities, how it fits into the grand perspective of testing and what it could mean. I will say that the approach was to both the city as well as the county. I spoke to the mayor today, and he's going to bring it forward to his one of their administrative committees tomorrow to talk about it and possibly in front of the common council in about 2 weeks to take action. But Dr. Stallone, I'll let you take it from there.
Sure. Thank you, Jason, and members of the legislature for the opportunity to bring this forward to you, and thank you for even considering it. The Rheonics platform is in place and in use already. We ourselves extended and bought 2 of the devices pre-FDA emergency use authorization approval, which then came. We evaluated the platform and we're very optimistic about its promise, and our lab enterprise works very closely with their science team. This does fit into a portfolio of platforms, meaning this is not the only platform we rely upon, but frankly, it's the most promising for a number of reasons I wanted to let you know about. We would like to have ultimately 7 of these, and we appreciate the county's generosity and considering and hopefully moving forward with purchasing one. But each machine can yield about 100 samples daily, which is 1 patient per sample at the present time. And with 7, that is it's between 650 and 700. The promise is that our lab team, which is already working on the problem, will accomplish the ability to pool samples and multiply that number by between 4 and 5 to bring our daily capacity into the thousands, which is likely what is needed to support things like school reopening and other larger scale economic reactivation in a deliberate way. It's a local testing platform, meaning the analytics get done under our roof, as opposed to sending samples to the Mayo Clinic in Rochester or out of state to Quest or LabCorp, which oftentimes takes days. That's the reason that the delays individuals have experienced are as long as they are. So with 4-hour turnaround, with the ability to accomplish pooling, which Jason is going well. I checked on our team. We're about 2 weeks out to submit to New York State to accomplish that multiplication of capacity. And then we have our other platforms as backup. And we're working actively with Cornell University and the schools. And we think that this, when all of those units are up and running, and there's of course logistical challenges to that, reagent supplying, but Greg Galvin, the CEO of Reonics, is working diligently and around the clock with his development team. And by early June, we'll be able to support our end strength number of devices under our roof. And so this does represent an important capacity for the community. Our vision is to accurately and rapidly detect any change in prevalence so that other public health oriented actions can be taken to cool what's going on. And so we hope that that doesn't come to pass, but we need a good, strong surveillance program. Jason is actively in discussions with us in designing and implementing that with the appropriate stakeholders. And I'm very optimistic that this is going to be a key capability in that fight. So I'll stop there. There's a million questions that you may or may not have, but I'm willing to address those in conjunction with Jason.
All right, thank you, Jason. Thank you, Dr. Stallone. I know the resolution is not on the table yet. I figure we'll get this part. So hands are going up. I see Shauna, I see Annie, I see Amanda, Mike and Martha. Like that? Yeah, I'm working on it. I'm gonna sign a record deal soon. Shauna.
Yes, thank you, Dr. Stallone, for coming in and explaining this to us. I want to just thank Cuba Health Partners. You've done an amazing job with the testing in our county. Almost on a daily basis, I receive feedback from constituents that talk about how the process, how your staff was friendly, how it was easy to get a test. And I think this really contributes to the fact that in Tompkins County, we've really seen a flattening of the curve. And the only way for us to continue that is to have accessibility to the testing. So I will definitely be supporting this resolution. And I thank you for your efforts.
Thank you.
Annie, Anna.
Thank you. Marty, I'll keep this short. I just want to second what Shauna said, and I am totally in support of this. Even if we don't get reimbursement, this is a small thing that we can do, especially compared to all the great things that you've done for our community. So thank you.
Thank you. Anna, Amanda. Oh, I like the A's.
Thanks, Leslyn. I will third that. Thank you so much for all that you've done for the community. I've had a ton of questions, so I'm going to veer slightly on, what are the steps that the system has taken to address any surges, and I think we've shown tremendous steps have been taken. So thank you. There are two questions that, now that I have you here, that I'm going to sneak in that aren't directly related. So I apologize.
No, they better be directly related to the purchasing of this machine. I'm going to cut you off if they're not. You can ask them later.
They're related to medications, just whether
purchasing of machine, of the Reonics machine.
I shouldn't
All right, thank you. Thank you, Anna. I love you. Amanda? Amanda.
Yes, thank you all. I'm very happy to support this, and this may seem like a weird question, but I am wondering what happens to the machine when we no longer need it for this? Can it be used for something else? Where does it go? Does it end up in a landfill? Like, what happens to it?
Number one, I think the horizon for this problem is going to be longer than we think. So I think that it'll likely be probably, again, no one knows for sure about the availability of a vaccine or things like that. But I think we're talking about probably years of COVID testing in conjunction with other tests that have to happen. I think the demand for flu testing will be also increased, which this device can be used for as well. I wonder that question. I just want to validate your question. The nation is ramping up the production of ventilators. The nation's ramping up central testing analytic capacity. So I think there will be some spare capacity, God willing, at the end of this. But I think that the value of the machine on a horizon of a year, just to pick a number, would be more than justified.
Great, thank you.
Thank you, Amanda. And can you please put your hands down when you're done asking your question? Y'all are confusing me here. I'm going up my screen, Rich, and then Martha, I'm coming to you on the end after a couple of people. Rich.
Thanks. Dr. Stallone, is there the reagents, the supplies, and the trained personnel, are any of those limiting factors for use of this machine?
In short order, no. We have the ability to, certainly the reagents, I was mentioning Greg Galvin, by the beginning of June, they'll be able to support that number of machines. That is one of the limitations of the number of machines they've deployed in the region. I believe right now they have 6 or 7 deployed, 2 at UHS, 2 at SUNY, and 2 here. And then the incremental ones they've committed to us first. And so they're really limiting that. We have only 3, the third, and that we're doing the pooling testing with, but they'll be able to support 7 by the end of May, beginning of June. And so again, we would analyze our situation at that point and decide is there incremental capacity. But I think the number that we would get with that pooling technique, which I'm optimistic we're going to get a hold of, then we start getting constrained by people and sampling limitations and things like that. So I think that's the right end number. That's the number 7 that can be supported by Rionics. And that's the number we can conceivably field human beings to sample for.
Thank you.
All right, thank you, Rich. Now on to the M's, Mike Sigler, Mike Lane, and Martha. Mike Sigler.
Hi, Marty.
Hi, Mike.
My question about the machine is how adaptable is the machine? So twofold question. If they come up with a better sampling system, whereas maybe you can do a cheek swab as opposed to the nasal swab, will this machine be able to adapt to that? And say there's a mutation in the virus where we have a different, almost a different virus actually running, will this machine be able to be adapted to test for that as well?
Good questions, technical questions. On number 1, you can use different sample types in the machine. It's a PCR machine, polymerase chain reaction. I studied this when I was a molecular biology undergraduate student at Cornell in the 90s, but they've gotten to the place where they can now do it in bulk. And so, yes, if we get a saliva sample, which is a separate project we're working on, our lab is independently working to collect saliva samples as an alternative to nasopharyngeal swabs, to have a anterior nair or nose swab plus a saliva sample. We're working on that. The machine would work on that. And if there was some change in the virus itself, the reagents would change. The primers in the PCR process would change, but not the technology. So the same technology that's existed since the 90s has now been adapted to this virus. And researchers look for good targets, which detects RNA that actually matches the sequence of the virus that's in circulation, if you will.
All right, thank you, Marty. Thank you very much.
All right, Mike Lane.
You've heard me say before that Tompkins is the best county. I've said that more than once. And here's a perfect example. Shauna, what you said is exactly right. We have had the benefit of great leadership at the county from our county administrator and our health department. We've had wonderful cooperation from Hugo Medical Center and in the testing. And now we've got a local business that is producing a very vital piece of equipment. It's why Tompkins County is the leader in this crisis is trying to find a resolution of it, a flattening of the curve, as Shauna said. I want to thank everybody involved here, and certainly we ought to buy this piece of equipment. Thank you.
Thank you, Mike. Martha?
Thank you, Leslie. Hello, Marty. And thanks for your message back this morning. We corresponded about the amazing story about Elizabeth Clark and her parents, and your staff welcoming her parents here for their last hours. And that was, everybody should see the Ithaca Journal story from Saturday. I really appreciate all that your staff, you and your staff have done throughout this, and that's a prime example. So I have a technical question. You mentioned pooling, and I heard that today for the first time, but I don't quite know what you mean. What is that?
Sure. This is something where if you're in a low prevalence environment, meaning you have a more than likely chance that a group of people are going to all be negative, you can take samples from all of a small group. We're talking about 5. I think the state has put a limit on 5. Take the samples and mix them into one sample. And then you run that in the machine. And if there's no RNA, DNA detected, that means all of those individuals can be deemed negative with one test. So you take a machine that can do 100 tests a day and you multiply that by up to 500, but then some of those runs are going to be positive. So you have to go back to the stock where those 5 people's samples were kept separate before they were pooled, and you have to run those 5 separately to determine which of the 5 or which set of the 5 were positive. So obviously it's a very careful process. There's a lot of tracking that has to happen, a lot of safety assurances for the state, and the machine has to be tested to be sensitive enough to pick up the virus in a smaller sample size. So we usually take part of the sample that we collect per person and run that. And so we're doing those experiments right now in conjunction with the Rheonics science team so that our lab can develop what's known as a locally developed test to do this. We would be the only lab in New York State that's doing this. We would, of course, share our technique with UHS in Binghamton and SUNY in Syracuse, unless they get to it before we expect to get to it next week, in which case they'll let us know what they did. But I'll just share with you, CHS personnel, including myself, are volunteering on asymptomatic negative, presumably negative samples to accomplish this testing, and we're underway. So we hope to not only employ the technology, but improve it and share with other hospitals in our region.
That's fantastic. That makes so much sense. Thanks for explaining it. And another example of being the crown jewel of Tompkins County, to use Mike Lane's phrase. All right.
I'll take it.
For being here and for doing this.
Thank you, Martha. All right, Henry, you're messing with my alphabet. Henry?
Thanks. Thank you, Marty. You talked about other platforms that you'll be undertaking. What are they? Can you describe just quickly what the other platforms are?
Yep. Number one, we have a lab relationship with the Mayo Clinic, and that's the vast majority of the lab samples that we collect get overnight FedExed to Rochester, Minnesota, where they are put on the Roche platform, which you've probably heard about in the news. Wadsworth, early on, the state lab was a destination. We own a separate platform called Panther. However, the reagents are in short supply, and I know the county has advocated for us to receive reagents for that platform. Incidentally, that would be an incremental 1,000 tests per day, but that's being distributed based on hotspots and through a central process that includes state and federal government. We have access to soon an Abbott ID Now. Those are the 45-minute turnaround tests, but much lower quantity. So that would be used for mothers in labor and things like that. So all of those together are our stable of platforms that we bring to bear. Again, the workhorse would be the Rheonics platform if we got those 7 machines. That's our quickest path to assured testing capacity. And by assured, I mean that the Hologic Panther reagents don't get denied to the county in some future period. It would be nice when they come, they could provide redundancy, but I'd like to rely on the Rheonics.
Also, you talked about that Ronics can handle 7 in their area. So does this preclude other places from getting them if you get the 7?
Yes, but we would, yes, I mean, there are going to be a capacity. And so I think that their machines are in demand. Lab capacity is coming online. I think the argument for us to get them, frankly, is our advancements that are happening in conjunction with their science team, that we're collaborating closely, the proximity of our hospital to their headquarters, basically, and our ability to innovate with saliva samples, for instance, and our ability to share with other regions. We could export testing capacity. Instead of being the exporter, we could be the importer if we needed to. So I think that we've demonstrated our lab is atypically complicated and capable for a community health system. I'll just have you know that. And if you can believe that we have an atypically good lab. So I think we're a great place to place this capacity. And I think in larger centers, they might have platforms like the Beckman and the Roche directly. So I think this is a good place for Rionics to be filling in capacity regionally.
Thank you.
All right, Marty, thank you. And I know it doesn't get said enough. And so I want to take this opportunity to really share publicly and with you, with all the legislators present, how much we value, incredibly value the partnership we have had with Cayuga Health Systems, with you and your team throughout this entire COVID-19 pandemic here. We could not be in the place that we are without you all being present. So we really do appreciate that partnership. We appreciate you all jumping on board with us and trying to stop the spread of this disease in our community, do the testing, do all the things that that was needed so that we can flatten the curve here in Tompkins County. I also want to appreciate the fact that we have, and you're partnering with a local business that's here, where it's easy access, as you just said, that we can contribute to the own development in our community here. So I do want to thank you. I do want to send the word to your entire team how much we appreciate that partnership with you all. I know there are lots of communities that this is not happening. You all have been leaders, not just in, okay, let's just get out there and sample people, but thinking of what's coming next, being some forward-thinking folks, and what do we have to be looking forward to, hence, you know, the purchase of, or to reach out to purchase this machine. And it's a small gesture, it's a small thing that we as a county can do to show not only support for Cayuga Health Systems, but for our entire community, you know, coming forward as partners. Our community feels safer when they know that our government as well as our health systems are working in tandem with each other. I think it really does matter. So thank you so very kindly. And I do see your hand. I'm going to ask to put the resolution on the table, and then I will acknowledge you. Is that okay?
Happy to put it on the floor, but yes, that's fine.
All right. Shauna, do you want to move your resolution?
I would like to move Resolution 9351, appropriation from contingent fund to purchase a Rionics Encompass MDX workstation to enhance COVID-19 surveillance testing in Tompkins County and the Southern Tier region.
I'll second that.
Loud and clear, seconded by Deborah. I was about to, but you beat me to it. That's all right, Deborah. Seconded by Deborah. I'm sure there's lots of hands going up to second. Any continued discussion? Anna?
I'll get in touch with you, Marty, directly. Thank you.
Okay. Any other conversation on the resolution that's on the floor? No. Roll call vote.
Amanda Champion,
Yes.
Deborah Dawson,
Yes.
Nice and loud.
Henry Granison,
Yes.
Rich John,
Yes.
Anna Kellis,
Yes.
Dan Klein,
Yes.
Ann Corman,
Absolutely, yes.
Mike Lane,
Yes.
Dave McKenna,
Yes.
Glenn Maury,
Yes.
Martha Robertson,
Yes.
Mike Sigler,
Yes.
Shauna Black,
Yes.
Leslie Clairborne,
Yes.
14 ayes, 0 noes.
Thank you very much, colleagues, for passing this unanimously. Marty, thank you for joining us and for sharing information. I'm sure this legislature is not done with you. So I hear already calls that are coming your way.
Sure, no problem. I would like to say one thing. Number
Sure.
one, thank you to everyone for this. This is very much appreciated by a number of people. And of course, on behalf of the patients that don't even know what you just did, thank you very much. And hopefully we'll get the word out. Secondly, I'd like to thank Jason and his entire capable administrative team, who we've been working with a lot. And we feel your support from the legislature, but we also appreciate the partnership and the professionalism. I see Amy's on the call, but we spend a lot of time talking with Frank Krupa and Jason, and it's been a really good partnership, and you have a good administrator. So we really appreciate his leadership and involvement. And he did not pay me to say that, so.
I'm not sure, Marty. I'm not sure. I was wondering. He can't see you. You really can't.
You
But
should have
thank you.
held out for money.
Thank you so very much. Both of you, thank you for your forward thinking on it. It's going to do a great thing in our community. And again, thank you, legislators, for that vote.
Okay.
All right.
Sign off.
All right. Thanks, Marty. Take care.
Good night.
Good night.
Marty, appreciate it.
We will continue to move on. Before I get to Jason, I do want to take a quick moment. There were lots of things said during privilege of the floor that reflected some of what I wanted to say, but tonight's resolution, just in recognition of Asian American, Pacific Islander Heritage Month, Older Americans Month, and all the work that people are doing. I know that these days I'm beginning to feel like the walls are closing in on me. Just being, cooped up and everything else. I know for a lot of people, the feeling is the same, but I do want to encourage people to pick up the phone, to call somebody, an old friend, an old relative, someone, what did Martha say? Uncle John or Jake in Texas, whoever it is. Just please reach out for your own mental health. Call Mary Miller and let her know, we've seen her sign and, we just want to say, hello. Anything to break the routine for yourselves, all of us. I'm talking to everybody out there in the land watching, how important it is for all of us to be mindful and to manage our own mental health. We may feel that it's not the same. I work at GIAC and I go in there days and it's so not the same that I'm beginning to feel it. There's no noise, there are no children, there's no staff, and it can begin to get to you. So I encourage people to please reach out to mental health professionals, reach out to each other, anyone, just to talk, just to let people know how you're feeling. Take a walk. The weather is getting nicer, but wear your mask when you do. And please just, if nothing else, please do take care of your own mental health. Break routines, do whatever it is you need to do, and check in on other folks. I can't emphasize that enough. So thank you all very much for letting me rant on that little bit. Moving on, County Administrator. Report, Jason, do you have a presentation for us?
I have a brief one. It is brief, but I will share the screen. Appreciate Dr. Stallone's support and kind comments. The truth is it's the relationship is a two-way relationship. It's been very challenging in over the past 10 weeks when you talk about relationships and then put to the stress test of stressful situations. And we've benefited, I think, of having good relationships with a lot of people, especially CMC and their support. So it's definitely it's definitely a two-way street. So we appreciate that.
Hey, Jason.
Yes, ma'am.
Before you continue, I think Natalie is on and she might be waiting for resolutions C and D. Would it be okay if we just take those up so Natalie doesn't have to continue sitting through?
So you're gonna bump me for a new department head? You're not gonna let her suffer?
I am so gonna bump you. You just got all kinds of bragging stuff from Marty.
Absolutely.
You can sit and wallow in your brag. And so Natalie can, go about her business. Is that okay,
Absolutely.
legislators?
Yes.
Okay, so why don't we go there and do resolution C? That's Anna, that's your committee, C and D? And we'll just do the resolutions. We'll come back to reports.
She's muted.
Anna, we can't, I don't know what's going on. You're muted.
I unmuted. Can you hear me?
Now we can, go ahead.
And this is resolution C, appropriation from contingent fund and authorization to enter into a multi-year lease, workforce development ID 9310. I so move.
May I have a second, please? Seconded by Martha. Any discussion on this resolution? Natalie, is there anything you want to share? You don't have to.
I just want to thank Jason for yielding the floor and and to say that this just reflects a rent increase. As you know, the Workforce Development Board staff share space and are co-located with Tompkins County Area Development. So this enables us to continue a really positive working relationship, workforce and economic development side by side.
All right, thank you. Any other questions? Roll call vote.
Amanda Champion,
Yes.
Deborah Dawson,
Yes.
Henry Granison,
Yes.
Rich John,
Yes.
Anna Kellis,
Yes.
Dan Klein,
Yes.
Ann Corman,
Yes.
Mike Lane,
Yes.
Dave McKenna,
Yes.
Glenn Maury,
Yes.
Martha Robertson,
Yes.
Mike Sigler,
Yes.
Shauna Black,
Yes.
Leslie McBean Clairborne.
Yes.
14 ayes, 0 noes.
Thank you very much. That passes unanimously. Go ahead, Anna. D.
D is appropriation from contingent fund terminal pay, Workforce Development Board ID 9309. I so move.
Second.
And if
Second by
I'm
Mark.
slouching,
Second
y'all-
by Dave McKenna. Dave, did I see you seconded? Yes.
I was just gonna add, if I'm slouching y'all, it's because Deborah is not here to give me her ibuprofen supply. So just bear with me.
Is there any questions on this resolution? Very straightforward, terminal pay. Okay, roll call vote.
Amanda Champion,
Amanda?
Yes. I didn't hear my name, but yes.
sorry. Deborah Dawson,
Yes.
Henry Granison,
Yes.
Rich John,
Yes.
Anna Kellis,
Yes.
Dan Klein,
Yes.
Ann Corman,
Yes.
Mike Lane,
Yes.
Dave McKenna,
Yes.
Glenn Maury,
Yes.
Martha Robertson,
Yes.
Mike Sigler,
Yes.
Shauna Black,
Yes.
Leslie McBean Clairborne.
Yes.
14 ayes, 0 noes.
All right, passes unanimously. Thank you very much. Anything else for Natalie while we have her captive?
Thanks,
No?
everyone. Thanks, everyone. We really appreciate the votes. I would just like to jump in and say that the 24-member Workforce Development Board of Tompkins County, which is 51% private sector led, and includes all of the relevant agencies, is in support of the HEROES Act. This includes significant funding for the workforce development system throughout the county. That's all of our apprenticeships, all of our online training, any of our on-the-job training, our summer youth employment program, and lots of other support for both businesses and for workers. So I'll be nudging those 24 to call 202-224-3121 tomorrow. Just wanted to let you know.
Yay. Natalie, don't go. I see a couple of hands up and I don't know if it's for you. Thank you for the shout out about the call number again. Ann Corman,
Thank you. Natalie, I just had a question. Last time, I think you said there were around 400 job openings in the county. Wondering if you had a rough number for now?
Yeah, so you're talking about our workforce redirect. Last time I looked, which was a few days ago, we had 150 businesses, separate businesses offering close to 500 positions throughout the county. These range from everything from grocery stores, food delivery, a range of healthcare jobs, and also a really interesting mix of employers who are offering jobs remotely and over virtual platforms. So, you know, compared to a number of unemployed in the county, you know, there is a big difference, but we do see these 500 jobs as a sign of resiliency in our economy.
Thank you.
Thank you. Martha, did you have a question for Natalie?
Yes, thank you. And I think one of those jobs is your deputy, if I'm not mistaken. Is that right? We could advertise.
You are right, yes.
Yeah. Thank you very much for mentioning the HEROES Act. This makes me think, Jason, could we ask department heads if there are other specifics like that could help us to advocate? That would really be great information. And you know, and Natalie, is it possible for the Workforce Development Board to put a letter together? Does that feel like that'd be appropriate?
Yes. We had originally planned to do that in anticipation, but the bill arrived on the floor of the House so quickly, we actually didn't have time. We are going to do that in anticipation of the Senate vote.
Okay, that's fantastic. And we can share information maybe that department heads can have a look at if they don't have it. Thanks, Natalie. I really appreciate all of that. That's real important.
Sure.
Anna.
I actually just wanted to acknowledge Natalie's incredible work for everyone. You have been with us just for several months now, have jumped in kicking, set up funds, set up programs for redirecting jobs, helping people find jobs. I think that I just want to acknowledge that a lot of this is to an incredible amount of work that you're doing. So thank you so much. Very creative, outside the box thinking.
Well,
beautiful. Thank you, Anna. Thank you all for the resolutions. Natalie, thank you for hanging in with us. Have a great evening.
Thanks, everyone. Have a good night.
All right, I'm not bumping you. Anybody else now, Jason? It's your turn.
Oops. I do have a brief presentation, kind of a similar update that we've been giving over the past few weeks, and it will be added to the long timeline that we've done. So we have a week-by-week update that we've been doing now for, I want to say, 3 or 4 legislative meetings, and we'll include this as well. And all those are put together, and they're on the website for anybody to look at any time. So I will put this up and share it. Everybody can see that? Yes, everybody can see the slides. It says May 15th, May 18th. Good.
Yes.
So I'm going to go through this briefly. I won't go in every detail, but I'm going to have to answer some questions. Again, it's a good format that we've put together. Thanks to Dominic and the team for putting together a good, I think it's a consistent format for week to week. Talks about just some, as you see, we have 8+ cases in the past 14 days. So we're really coming to a slow and a leveling off. Executive Order 20230 and 20231 added some new insight. It's really the reopening executive orders, and 3.1 it also allows municipalities to discontinue its 50% of workforce limits come May 28th if it sees fit. Those are 2 pretty big executive orders, and they can probably be replicated and have been replicated as more regions become online for the reopening. At the beginning of this May 5th, at the beginning of this last few weeks, legislature did pass resolutions moving forward with furloughs and some other changes personnel-wise. We have started conversations with a multitude of players, including our local libraries, to try to coordinate with them as to how they want to reopen. They, in phase 1, had the ability to participate in curbside pickup. So we're working with them on a coordinated message. We've also had some different conversations with landlords, really more about information gathering and answering some questions. It's a preliminary conversation. We've had a series of we've done 2 stream town halls, one at the onset of reopening last week and then at the last part of last week. We also have one slotted for this Thursday. And it's been really well received. A lot of good questions. Leslin joined us for the last one. Shauna's going to be on the one Thursday. Good questions from the public, good questions we're getting preemptively. So a lot of positive feedback, and a lot of people are watching these recordings, which is good to know. Also, we launched a Moving Forward website off the top of the public health website. Again, a lot of hits, good ability to put messaging out there. And then, unfortunately, we had an incident with a local grocery store. We had to do a public notification. Thankfully, not really much has come from that in terms of positive cases. And this is a slide you've all seen before. Again, this is the kind of COVID-19 hours. Again, I put your attention to really the overtime pay on that first series of boxes is the one that could be reimbursed. Regular pay, not necessarily. And comp time is really just the accumulation of hours, primarily from management staff, that do not get paid for any other time worked above 40 hours a work week. Estimated emergency leave. So this has changed, and as you can see, you see how it ramped up in the onset at the late March and really throughout April. That's when emergency leave was really put into place, and we really scaled back on operations. May 16th, if you see, there was a decrease in use of emergency leave, and that's a big part of that decrease is due to the increase of folks on furlough. Really, it's a big part of it because a lot of people on furlough we're utilizing a big portion of emergency leave. And I think we'll continue to see that level off, at least for the next pay period, and then probably get less into the future pay period. Our related expenses as of the 18th was at just over 60,000, or just under 60,000. I will say that the Rionics machine will fall under this expense. And I think after we make that purchase next week or so, we're going to take a stab at submitting our first submittal to FEMA for reimbursement costs and take some bets as to when we think it'll get paid. But we'll start that process and see how to navigate it. We have been assigned a FEMA rep. Jess Verifus has been in contact with that person. We're going to have a discussion probably early next week about how we make that submission. On a side note with that, we are going to try to identify what is the best way for everyone, how this submission should work. Should we do it centralized on behalf of municipalities and nonprofits or not? We want to give some good, clear guidance on it. We just don't know yet. But we're gonna work hard and think hard on that issue to make it easy for our partners and what's the best way to approach it to maximize reimbursement. So more to come on that. One big thing is the past 2 weeks we've been working on our what we call now the ROOPs, or the reconstitution of operation planning, opposite of the COOPs. That was the onset. I gotta give a real good compliment to Jay Franklin, the planning folks, Katie Borgella. Lauren Cottrell, I think, is on the call. Bridget Nugent. They really did a stand-up job on putting this route together. So much so that we made it public a week and a half ago. Got a lot of compliments from municipalities and other partner agencies. We were ahead of the state's guidelines, which thankfully, we were online with what the state was going to do and what they expect. And these are the different categories that people take into consideration: staff considerations, employee engagement, facility considerations, operations, and then fielding operations. So what have come from this is a series of directives we're looking over right now that will cover anywhere from purchasing of cleaning supplies, which is more of an internal issue, mask wearing, both employees and visitors, wellness checks at the beginning of everyone's shift, and a few other directives. We're trying to get through them now so we can issue those directives internally to staff. And some of them, depending on the length they're in place, may turn into more formal policies that we bring forward to the legislature for adoption. We need to get them out and get some direction now in anticipation next week or so. So depending on how they go right now and the length that we may be using them, they may turn into more formal policies. We're trying to look at all that at once. But they've done a great job, this team, of putting this process forward. Departments have been good participants. They've brought up good ideas. They're sharing ideas on reopening. As you can see, we have our own little phase 1, phase 2s, which is kind of a partial reopening and then a full functioning reopening. We're going to be meeting this week as a group to kind of talk about when these are rolled out, and they may be different for different departments based on a variety of issues, anywhere from need for public access versus staffing accessibility and how we roll that out. So a lot more discussion internally on that as well. Here's just an updated number from the Food Bank of the Southern Tier with the amount of food that's been delivered, pounds to pantries, pound to meal sites, disaster relief. I mean, quite a bit of distribution of food, and you can see huge increases in terms of comparisons to prior months as well. Again, this is a statistic that I think will only continue to grow. There's also, as you know, a new group working on trying to make a more centralized food policy approach to this, which will only help distribute food amongst those in need. But hats off to the Food Bank Southern Tier. Hats off to the school districts too. They've really done a phenomenal job, much better than I can say my colleagues have reported in their ability to deliver food. PPE supply distribution. This has been a discussion, so we've tried to summarize it here. We have gotten quite a bit of masks, cloth masks from the state. You know, those masks are not, I mean, they're good cloth masks. They're not going to last forever. So after a few probably runs in the wash, I have a feeling they'll start to fall apart. The real nice masks are the ones that community members are making and donating and contributing. You can see the blue boxes have over almost 1,700. The EOC operation had 1,000. They continue to come in. I check the box up in T-Burg on my way in, well, usually every morning. Sometimes I forget a morning, but and they continue to come in. Great designs, real good quality. So to all those mask makers out there, you definitely have earned a special spot in the community because you are just absolutely knocking out of the ballpark with it. It's impressive to see. And some of the cool designs they come up with are great. Other things that we've distributed, this is stuff that's come through the EOC. As you can see, most of it is going to priority folks, Cuyahoga Health Systems, skilled nursing facilities, businesses, and nonprofits that have requested it. And again, early on, I don't want to lose track of this, but early on, a big part of the donations of PPE came from higher ed. Cornell really found, you know, a lot of different PPE and different nooks and crannies of the campus, and big hats off to Frank Catone over at their emergency management office who helped deliver a lot of that to us. So we appreciate that. IC also has a good contribution. So that seems like eons ago in mid-March, but it's all contributed to a list that we have here. As we are moving forward, we're changing our messaging. So last weekend, we had our first new messaging. The PIO team did a good job on capturing that messaging. This is a little, you know, this is the graphic that we've come up with. It's on our website. We do have some posters that we're going to be making in mass production for not only for our departments, but also for some community partners that want them. They have the good public health logo on it. I mean, this is a good message. We're going to continue to push this through a variety of different forms, including our public forum that we have, the community forum that we've been doing. We're trying to try and do it every week as these things are changing weekly, but also any other avenue we can through media pushes, our online presence, as you can see, to put some interesting statistics of the last 14 of our online statistics, which I think are remarkable. But we'll continue to push this message multiple times. We think that the best approach to this is an offensive approach on education. Continuing to push the education, continuing to push the density, distance, face coverings, personal hygiene, much like when it was on the onset of things in early March. We think this is how you're going to really hit home with people trying to comply with what's the expectation moving forward. In addition to the respectful engagement conversations, the personal responsibility of individuals to take this on, all of that is part of this, but this is going to be a big piece of the messaging over the course of the next 2 weeks in anticipation where you think a lot of this will come up with when retail begins to open on a regular basis. A lot of questions have come up about enforcement. So we thought we'd add some slides in about enforcement. Today we learned several new interesting facts, and I've just started to share this with some of our economic development partners. I got a few phone calls in before the meeting at 5, but we're going to talk a little bit more in the next day or two. And that is businesses are going to be required as part of their reopening plan development and guidelines to enforce and ensure that their patrons are wearing masks in their buildings and their facilities, as well as social distancing. So it's going to be up to the individual businesses when they affirm that they've developed their reopening plan. That's going to be part of their guidance and their guidance structure. So we, that's going to be new. We're going to develop and continue the messaging. We've had several meetings with our environmental health folks, sheriff's office, and some community partners that are also participating in this. We're going to continue to meet. I know the team, I'm probably not going to be part of it, but the team's going to meet tomorrow or Thursday to really go through that element that was just really announced this afternoon at a regional meeting, regional control room meeting, where it's really going to be a responsibility. It's going to be everybody's responsibility, but it's really going to be a responsibility of businesses to ensure that they are enforcing with their patrons for wearing a mask and social distancing. So the key component to that is going to be the education piece, the reminding of education. The process that you kind of have here, this chart shows questions and complaints come in through different avenues. They're funneled to environmental health that responds with education and process and resources. And in certain instances, law enforcement will be notified. Again, they're going to follow a very similar process of education, respectful engagement. We want to push all that. And if there are questions that we don't have answers to, it'll be pushed up to the EOC and we'll get the answers to the regional control room that we meet with every day. There is the ultimate enforcement tool, and that is through the public health law, we have the ability to shut down businesses and organizations if they're not complying with the reopening plan that they create. Obviously, that is not anything we have come close to utilizing now, and we don't want to, and we don't think we will. 95+% of anybody that we've approached, actually probably everyone we've approached so far, has been compliant. They understand the education piece. It takes patience. It takes a little respect on everybody's part, but they've been understanding and they comply. And I think that's going to continue, at least in this community. We've had a high level of success. Some communities not so much, but I think that's our approach, and we're going to continue to work with that as long as we can continue to make progress. The left side just shows some total questions, complaints, some things that have come through environmental health. We have had an uptick in calls this past week with respect to reopening. We can expect that to continue, and we'll continue to distribute them to the appropriate agency. Again, there will be partnership with local law enforcement, and there will be partnership with local code officers depending on the incident and depending on the complaint or the question. Lastly, we continue to have the regional control rooms conversations. They happen daily. They've been, primarily more questions and answers, but like today was we got some good feedback. So the state's still trying to find their way with these meetings as well, but we have had some good pieces of information to pass on. It gives us also the opportunity to reinforce questions. Phase 1 opening, as you're all aware now, several industries were grouped. These industries were selected because they are less dense in terms of bringing people together. As phases 2, 3, and 4 progress, they are going to be circumstances or industries where the situations have more possibilities or opportunity for density. So it's a slow, gradual kind of shift into the phasing, which seems both practical and realistic as you monitor the healthcare metrics, which is also on the New York Forward webpage if you want to monitor them daily. I get this question now: what's going to happen with phase 2? Are we on track? And for the 29th, assuming our metrics don't change, we haven't had this exact guidance, but I would expect that either on the 29th or shortly thereafter, we would be able to quote unquote graduate to phase 2. So that's all I know to date. It makes sense that if our metrics don't change drastically with the reopening of phase 1, we could then move to phase 2, whether it's on the 29th or whether it's a week later. I don't know the answer to that question yet, but obviously when we do know, we will let everybody know. I suspect it'll probably be determined or announced on a governor's press call or press conference. As far as what is going to be in phase 2 and the guidance that's going to come with phase 2. So phase 1, we got that guidance on Wednesday before the Friday reopening. I would expect by the end of this week, we'll get some more guidance on phase 2. I doubt they'll wait 2 days before the reopening of phase 2 because they've already been through this. So I know they're working hard, the state. I have to give them credit. They've worked, the guidance documents are pretty thorough, much more thorough than anything I've seen in any other state. So hats off to the folks working at it. Just everybody wants the information now, and it just can't be done that quickly. Lastly, we are sharing, obviously, our information with our partners, our stakeholders. We're having a series of meetings on a regular basis. We are fielding their questions, getting back to them as quick as we can, and providing guidance where we can. The town halls, again, have been a success, and we're trying to share as much information as quickly as we can, as quickly as we can get it. And I think the response has been positive. I think people are appreciative of the proactive effort that the county's playing in this, the leadership role we're playing in this in the community. We've been accessible. We try to remain, whether it's myself, whether it's Amy, whether it's Frank, whether it's anybody, we're making ourselves accessible as much as we can for folks to answer questions. So all in all, things have gone well. We have not, knock on hardwood, I've not seen an uptick as of phase 1 opening, but I wouldn't expect to see that probably till after the weekend if we do have anything. But right now, things are going well. They're moving still at a fast pace, and we'll continue to react as we know information. So that's all I have on my brief.
All right. Thank you, Jason. And we in Tompkins County should definitely be really proud of the work we've been doing, from response to, reopening and continuing. So thank you and the folks in the EOC and everyone else involved. I saw Mike Lane's hand and then I saw Amanda's hand. Mike Lane?
Jason, a question. I know you met with the library directors. Can you tell us what's going to be happening with library openings?
Sure. I can tell you what I know so far, Mike. And part of the reason for meeting was, excuse me, sorry, I got sidetracked there. Part of the reason for calling the meeting is that there was, we've taken an approach. We were able to work with school districts and a lot of community groups and a lot of different organizations on a unified approach to things. And because we have quite a few, individual municipal libraries, as well as the Tompkins County Public Library, which is obviously the biggest one, I wanted to get the directors together to talk about a unified approach so that the public is aware and there could be similar approaches. Libraries share a lot of resources and information. So right now, we had also the Finger Lakes Regional Director on the call with us, and I asked her to help facilitate the conversation amongst the directors. Right now, they're looking to do, I think, an initial curbside service, probably sometime after June 1. We don't have a firm date yet. They've talked about a few dates, and we haven't circled back with them on a follow-up conversation. But most definitely into June, and then probably a graduation after curbside pickup into more of their
it's okay.
More of the similar retail operation that they have, where people are going back into libraries. They have some nuances, as you know. They have a lot of shared equipment, computers, access to internet, books. When they started getting into the things that they had to think about, it blew my mind, and I was happy they were thinking about it, because I would have never thought of it as to how they are trying to make safe environments for people to go in. So I think that the first attempt is going to be at a curbside service delivery. I don't know all the details to it, but what we did offer is, I said, I'd like them to try to work on a collective approach, and what we offered is we would offer our support through Dominic and the EOC to help communicate that to the public through a press release or some press coverage.
Thanks for that.
Yep.
All right, Amanda and then Martha.
Thank you, Jason. As always, very helpful. My question, you sort of answered, but I've had constituents, contact me, and I've seen lots and lots of posts on Facebook and questions about, people in parks and running and biking and not wearing masks. And, I don't know. I know there's a lot of concern, and I know that some signs have been put up in various, state parks. I guess I'm just looking for any other guidance on how we can, I don't know, is there any enforcement other than education? Education is the biggest one, of just getting people to know that they need to wear a mask or bring a mask when you're hiking or, whatever. But I don't know. I know it's a concern for a lot of people.
Yeah, and it's a concern we're getting a lot, and it's a good concern. I think there's several things that are going to happen on parallel tracks. One is the education ramp up is just going to take some time as we really make a concerted effort to push it out there. There is enforcement mechanism. There are civil penalties that can be issued, and like I said, on the business element of things, or organizational element of things, we do have the ability to close them if they're not complying. Obviously, that's the last piece of the puzzle. I think it just has to be a constant, almost to nauseum, continual repetition of this until people start to see it. I do think that the vast majority of people are complying, And when folks don't want to, they're to a certain extent being singled out by themselves by not complying. And I think that will take some time. Everyone also is a little sensitive right now. You're walking in a store and someone sneezes, you're probably a little overly sensitive just considering the circumstances, which is normal. So I think several things we want to do. We want to continue the messaging. The legislature, I think, is can be a great partner in this, because you guys definitely can reach out to a greater audience than we can individually. And as we continue to push this out, we definitely want to give you things to push to your network of individuals and community-based groups. The other piece is, we'll continue to receive those complaints. Some of the challenges is the real-time action of these things happening. So balancing law enforcement, balancing the response of, there were 5 people in the park that weren't wearing masks. And when I take that example, there could be a lot of reasons those people might not be wearing masks. They could be residing together and there's no reason to. They know that they're keeping their distance as they're going out in the public, and as long as they can keep that distance, they're not necessarily required to wear a mask within 6 feet. I think the point we want to make is people should be prepared to wear a mask no matter where they are, because there's a potential of running into someone. So I think it's just the continual education piece. And I think when we continue to do this, I think in the next week and a half, it'll be a different conversation. And the next week after that, it'll be another different conversation, because I think more people will get it after that. And where we have to respond, we will. Like I said, we've addressed some of these issues, Amanda, where there's been groups of folks that have been approached, and through a little education and respectful dialogue, they understand it, they comply, and they move on. And I think that's just the thing we all have to keep in mind as we go through it. It's not an easy thing to do.
Yeah. Okay, thank you.
Thanks, Jason. Martha?
Thank you, Leslyn, and thank you, Jason. A couple of quick questions, but about the mask messaging. I sent everybody, I forwarded everybody a request from Sue Pearlgut, who does video productions. Close to Home Productions is the name. She's looking for pictures of all of us in masks, and by tomorrow, no pressure, but she'd like to put as many of us as she can into her video. So I hope some of you will send. Look for that email. If you need it, I'll re-forward it to you. Jason, a couple of questions. Time on Thursday, the town hall on Thursday. I don't know if there was a time yet.
It'll be at 5 p.m.
5 p.m. And about the schools, it's great that the schools have done so much. What's going to happen over the summer? Do you have any idea? And then I also just wanted to ask about landlords and what that conversation was like, and what are their concerns?
So the schools is a good one. I know the governor is going to come out with some direction about summer school later this month, by the end of the month. Also this week, we're expecting some direction on summer recreation programs and summer camps. They kind of also fit in the childcare realm. Outside of that, schools, I don't have any clear direction from that as to what's going to happen. I know schools have been asked to put plans together about reopening. I would imagine they're going to be, have some heavy oversight. As a parent myself, there's a lot of questions about sending your kid back to school, particularly young ones like we have. We have young ones under the age of 10. So it's definitely a concern, I think, for a lot of parents. Unfortunately, we don't have a lot of direction right now. Knowing the way the state has managed the crisis in general, and knowing the importance of schools and education, as well as the specificity that higher ed's taking in general, I'm going to imagine that they're going to have probably some pretty thick guidance on how schools are going to function.
No, I know their education is listed in phase 4. Actually, what I meant was about the lunches, that they've been delivering food. Are they going to do anything like that over the summer?
You mean after the school year? I don't know. But we can ask that question.
I mean, it occurs to me as another hole that's going to have to be filled. Thank you. And then landlords, anything in particular?
This was kind of a preliminary conversation to kind of gauge some feedback from them as to what type of influence they can have. I mean, it wasn't any of the larger landlords. It was more of the one-off, two-off landlords. I suspect we'll have more conversations with them. I also think that in the near future, we'll be having some conversations with different neighborhood associations as well. So this was just really, I think, an initial kickoff. I don't know if there's any substance that came out of it right now.
Okay. Thanks very much.
A lot of this is going to be, education, a lot of proactive education from a lot of different groups and entities and organizations.
Jason, can you stop sharing your screen because I can't see all the legislators?
I'm sorry.
Henry, I know you have your hand up or had your hand up. I'd seen you, so go ahead.
Okay, thanks. Jason, just a couple of quick questions. One, is the county offices and everything else, is that basically phase 2?
You know, there isn't a phase per se. You know, the executive order that restricted municipalities to 50% presence, you know, essential staff and 50% presence,
right,
has been lifted as of as of May 28th. So municipalities have the ability to begin to bring staff back. That there are a few other departments that fall under some slightly different categories. So for example, the district attorney, assigned counsel, as the courts open, have started to bring folks back. We're meeting this week to actually talk about how that may work. And we have, you know, our own internal approach has been a phased approach where we're slowly, gradually, you know, continuing to have remote work options in play, continuing to have restricted access in buildings, and then kind of filter, you know, phasing into a kind of a more into a fuller operation. So right now, May 28th is a go live date for municipalities if they want to bring back their staff full board.
You plan on bringing back the county staff on May 28th, after May 28th?
Probably not. We're, like I said, everyone has like a phase 1 approach. So a lot of folks are going to gradually grow into that. And I would envision that in the next week and a half, 2 weeks, we'll probably start doing some press as to what departments may be opening or maybe appointment only, or how they may function. Similar to how when we shut down, we did massive presses, you know, media pushes on what departments would be appointment only shut down. We'll probably do something similar as to how we reopen.
Also, are we going to continue to get PPE from the state?
We've had this question, and our comment is, as long as we get it, we'll continue to distribute it.
Because if everyone's required to wear a mask, there's going to be more demand on masks.
We have, I mean, so employers are required to provide masks to their employees. And individuals, you know, have been asked to continue to try to take the means they have to make masks. You know, it isn't an issue of if you don't have a mask, you know, if you can't get one from us, you don't have one. It's everyone's own personal responsibility to wear one. When we started distributing them to the public, we did it initially through the school district distribution of lunches for those in need. And now we're at a public distribution. I think last Thursday we talked to the municipalities and we delivered all of them a certain proportion of the ones we got from the state. So to the extent we can continue to do that, we will. I'll be honest, I don't know how much longer mass distribution we'll be able to coordinate. Pretty soon, folks are going to have use their own resources to get masks, and it'll be really the very limited that you know, the folks that are really much in need that will be able to provide that support to.
Okay, one last question regarding the universities. Like Ithaca College announced they were going to open in October. Did they? I mean, A, can you give us an update on your talks with the universities? And B, did Ithaca College submit a plan or something, or?
So we have had very good conversations with our higher ed partners. I want to first say that, and I will say this, that through this crisis, our communication with our higher ed partners has probably been the best it's been in probably 50 years. I mean, that's just my take on it. I mean, it's been very communicative. It's showed the interdependence on each other, amongst ourselves and amongst all of them. So it's been a very good relationship, and it continues to improve, which we're happy about. So higher ed can't have, you know, higher ed's got to have some direction from the state as to how they're going to come back. I think I distributed to you a plan that higher ed had put together, had a huge amount of participation. I read through most of it. I didn't read through all of it, but I read through most of it. And it's good material. I mean, it's a good guidance. It's good documentation. It's a good thing for them to follow. I think that's been pushed with the chamber and the second floor and the governor's office. They're starting, and then we're getting feedback that they've been receptive to it. So in a matter of time, I would imagine, I'm going to say 2 weeks, the state's going to have to come out with some guidance for higher ed, because they're going to have to make some decisions about fall classes and what type of direction they give to incoming students. So I would say by the first week of June, we're going to see some direction from the state as to what they're going to do with higher ed or what direction they're going to give higher ed. I can tell you all three institutions are working diligently. They're concerned about how they bring folks back safely, what they do it, how they bring it back through phased approaches. They definitely are on the same page with wanting to communicate to the student life and student body as to how they talk about behavior, how they talk about off-campus behavior, that type of thing. So there's been unison there, and they want to have similar messaging on it. That's a little ways down the road, but not too far down the road. So those are conversations they're having. We weren't specifically privy to IC's announcement. That said, IC's announcement is really identifying a date and working backwards from that date. So as they begin to develop their plans, we've been very much part of their conversations. They came up with a very thoughtful plan on how to slowly allow students to come back on campus to pick up their belongings. If you remember, they closed when everyone was away on spring break. So unlike Cornell, where people were able to bring their belongings with them, or a good portion of them, IC was in a little different situation. They communicated with us. Frank primarily had a lot of communication with them, was able to work with them on a plan that everybody accepted. And it's a very thoughtful approach. The only thing I can say is I think higher ed has done a great job being thoughtful on their practice and their approach. They're communicative about it. And I think we're fortunate that we've been able to have that relationship as we've gone through this. So, the thing with them is they're developing it. Higher ed is inherently very complex. I mean, you have three different higher ed institutions that have very different atmospheres and landscapes, which is interesting. They definitely have a lot of manpower putting into this, and it's for them, it's critically important that they create a safe environment for their students, faculty, and staff to come back, and they create a safe environment for the community to feel supportive and confident that they're taking it seriously. So as we know more, I'll be happy to share more. Other than we're facilitating those conversations, we wanted to. They've been receptive to it, which is great to hear.
One last question. Have you received any pushback from the vendors about enforcing the mask rule?
Well, considering we just found about it this afternoon, I don't know if they know about it yet. I think it's going to come out. I think the most noticeable point will probably be when retail is set to open on a full-scale basis, because that'll be part of their guidelines and their reopening plans. So I was able to just talk briefly with Heather McDaniel and Jennifer Taveras before the Ledge meeting to kind of give them a heads up that this may come out. I think I'm part of a panel on Thursday afternoon with Jennifer and Heather and a few other folks the Chamber's holding. We're going to meet as a team, or the DOC is going to meet with the enforcement team tomorrow or Thursday to kind of get down some good messaging so we can talk about it more. And then, as questions arise, what we want to do is we want to be able to push out good messaging about this well in advance, be able to field questions, answer questions, and then I'm sure we'll get a gauge fairly soon. It's kind of no different than, no shoes, no shirt, no service. It's just now no mask, no service. It's kind of a similar type of thing, I guess. But we'll work with them. We're going to look to our partners at the Chamber, the DIA, and TCAD to continue to push it as well.
Okay, thank you.
Thank you. All right, folks, I'm aware of the time. Anna Callis and then Ann Corman. Let's move on. Anna, are you there?
Yep, just trying to make sure I'm not muted. Thank you for the presentation. A few questions. I'm hoping they're not too complicated. Do we have any sense of protocol if we see a surge? Like, will we go back to one phase back or all the way to the beginning? Do you know?
So there hasn't been any talk about reversal of phases. I think obviously that's the worst case scenario. There hasn't really been any real discussion about moving back in phases. I think the discussion has more been around you're just not going to move on to the next phase until you're able to get those things under control. I think to answer that question specifically, probably a lot of it depends on how those surges may happen. You could have a surge because you have a cluster, for example, in a congregate setting versus a random series of surges. That may dictate different things as well. But right now, there hasn't been any discussion about reversal of phases. It's probably more been about you're just prolonging the ability to move to the next phase, which kind of feeds to the business and the individual business approach of if people don't want to comply, it may just prolong the inevitable of not being able to open fully.
Right. Well, and it's hard too because it's clients, so there's a lot that they can't control. The second question is related to that last comment you made. What if employees feel unsafe with the protocols that have been put in place by their employer? and they've previously been furloughed, there's been conversation of, you know, if people can't be forced to go back if they feel it's unsafe, do they then lose unemployment because they have had the ability to go back? Do we have any guidance on that?
That specific issue, no. You know, I think your question is what happens if the reopening plan that the employer puts in place, they don't feel is appropriate or safe? You know, I don't know how to answer that right off the top of my head. My guess is the DOL hotline is still open for employees for the New York pause, where employees weren't feeling safe or that employers weren't complying with New York pause requirements. So that hotline is still open, and that's probably the best avenue to file complaints and concerns about reopening and employers not complying with reopening guidelines. But we can shoot up to the regional control room that specific question, Anna, because it's probably something we'll get in the next few days. It's a good question.
And the last thing I just wanted to add, Martha, you know that we're working on I'm part of the food bank, the emergency food bank and task force. And the task force has been working with ICSD. And the message that we've gotten so far is they do not have an answer yet or a decision yet on whether or not the food distribution will continue through the summer. So we're still waiting to hear that answer too.
All right. Thank you, Anna. Ann Corman.
Thank you. So I'm hoping, and it sounds like there might be signage coming along with more directions for stores and other establishments opening, because walking into stores, I haven't seen much, if any. One store I was in, one hardware store, 1 out of 4 people didn't have a mask. I wanted to ask one question is, as far as employees working at stores where they're at a cash register, for instance, and so they're having interaction with customers, are they required to wear masks?
I don't know the exact answer. I think part of this is going to depend on the retail guidance. The direction we were getting today is that, yes, they should be wearing masks. But, you know, let's defer. I will defer to the retail guidance that's given, because I think that best fits your example that you're giving is retail setting. You know, are employees required to wear masks? I can't answer it off the top of my head because I don't know what the guidance is. My gut is going to say yes, they're going to be required to, but I suspect the next day or two we're going to have more specific guidance. To answer your question, you know, to expand upon your comment, and there is a challenge in timing because certain businesses, say retail establishments, are considered essential. So they've been open, and there isn't necessarily great, you know, there isn't an essential business guidance yet, and some of that will fit in other categories that maybe are not essential. So the question came up today about essential businesses and where are they supposed to affirm to the reopening plan, and that's yet to come.
Okay, thank you. Last question is I haven't found on the New York Forward, and maybe it's in another place. There's, you know, the part where there's industries reopening by phase, you know, phase 1, 2, and it has phase 1 detailed of what they are, and phase 2, I guess they don't have it detailed, but I can you know, I can pretty well figure out what they are. But I was wondering, have the guidelines come out for the phase 2 organizations and businesses yet?
Not yet.
Okay.
Not yet.
All right. Thank you, Ann. Mike Sigler, you have the last word on this, and then we're moving on.
I don't know if it's a quick question, but I just want to know, Jason, this mask protocol, is this something that, I mean, phase 4 is entertainment and stuff. Are we looking at this mask protocol as something that's relatively permanent, or are they talking like phase 4 that's going to get pushed to the side as well?
That's a very good question. I don't know.
Mike Sigler, it'll be Mardi Gras up in here all day long, every day, with your mask.
It's a good question. I don't know. And I don't think anybody knows right now, because I don't think they've developed phase 4 criteria yet. Right.
Okay, thanks.
Yeah.
Just like we were making bow ties and ties to match your pocket kerchief, we'll be making masks to match your outfit. We'll be up partying with our mask on.
Socks.
And socks. We're on it. Just for the record, I was in CVS yesterday, CVS on Clinton Street, and they have signs up. They have had signs up already saying that, face covering is required for entering the establishment. So they, their businesses are already, sort of doing that. Just so you know. Jason, thank you for the report. Is there anything else that you need to report to us?
Only this, Rick will probably report on it, but the sales tax report showed that April was a 27% decrease compared to April of 2019. Interestingly.
Okay, thank you.
There's more to this. Interestingly, our projection and our model had April a 27% decrease over 2019.
Yep.
Complete coincidence. I don't expect it to continue, but I just wanted to bring that point to you. So right now, the model is on point.
We're just good like that. We know
When
what
did
to
we make
expect.
that projection?
Say what?
When did we make that projection?
Beginning of May, like April or May.
All right, thank you. Anything else staff-wise from either you or Lisa? Operations-wise, things are good? All right, moving on. Jonathan Wood, County Attorney. Do you have anything for us, Jonathan?
Just very briefly, hope everybody got the litigation update that I sent. Please, if you have any questions or comments, give me a call on my cell. As Jason mentioned, court is open now. They're accepting filings of virtually every sort. I think only evictions are the exception. And we don't do that. Hearings are still by Skype. But there's already a big increase in activity, and I think court will go on, as of now, fairly as it was before, only there won't be in person. It'll be mostly by Skype, at least for a while. And that's my whole report.
Thank you. Any questions for Jonathan? All right, let's get through Rick and then we'll take a break. Thank you, Jonathan. Finance Director, Rick Schneider.
Hey, I'd like to give you the sales tax report. Jason already gave the highlight. We're down 27% for the month of April. I sent the whole tax distribution summary to you by email in case you want to see it.
Yeah.
And that went out last night. As of the end of April, the year-to-date tax distributions for the county's portion totaled $10,900,000 compared to $11,400,000 the year before. It represents a decrease of $463,800 year over year, or down 4.06%. And I would also add that the 27% down just for the month of April, two things there. Henry and Jason and a number of people have talked about in the past how we always call these the same month that the state calls them, the April sales tax report. It really is for the month of March. And we went over that last month, how there's that time lag. And this month also included a $75,000 withdrawal of AIM funding. Remember when we spoke about that back in November and December, that they're going to dip money out of our coffers twice a year. This happened to be the month where they took $75,000. So with that added back in, we would have been down about 25% versus the 27.19%. I also included on my summary sheet something that you might want to take a look at if you haven't seen the email. There's a little table at the bottom there that shows internet sales for the September through November quarter. Oftentimes, Martha and a number of legislators have asked for information on how's this new internet thing working and what are we getting from the internet? And we've never had any numbers at all to share with you. This is the very first I received anything, and it came from Dave Lucas with NISAC. And in that table there, it shows that in this particular quarter that they've chosen, September through November of 2019, that the internet sales for counties was up on average 97% from the year before. 97%. That's a huge increase. The chart summary says that the average counties realized 97%, but the range for each and every county between 68% and 118%. Tompkins County there is shown right in that in the middle, and we're right at about 96%. So we're very close to the average. The bottom half of the page there shows the last 7 years just for Tompkins County of internet sales for that quarter. And you can see how it's gone up from 2013. The name of the category is electronic shopping and mail order, but that's where they put internet sales. And it's gone, the taxable sales, this is not the amount of money that we got or the distributed amount of money, but this is the overall sales number for internet, went from $7.5 million back in 2013-14, all the way up to $24.9 million worth of sales. And you're thinking like, well, how does that translate into the amount of money that we actually get? Well, you just take 4% of that number and you're at $996,000, or basically $1 million that comes from internet sales. It should be noted that big box stores, I didn't know this, but big box stores like Walmart, which have a huge amount of sales now generated by the internet, they don't report their internet sales under this category. A tax filer is categorized by their primary industry classification. So all of their sales for Walmart would be categorized under their primary code. So even though you see the internet sales here being reported, it doesn't include the internet sales of big box stores. So it would actually even be a higher number. So I thought you would be interested in that, and I just received it in the last week.
Thank you, Rick. Questions? I see Deborah and then I see Shauna.
Yeah, thank you, Rick, I guess. I would say that mail order business seems to be increasing substantially. I went to UPS the other day because I had to return something, and the guy there said that their numbers are through the roof. Their Christmas numbers, basically, is how he put it. So if that's any indicator of what our internet sales tax receipts ought to be, that's encouraging.
Thank you. Shauna.
I think if there's any indicator about our internet sales tax, it would probably be the fact that I bought a butter churn at 2 a.m. from Amazon the other night. Forgot I bought it, and then I got it, a week later. Totally forgot about it.
Thank you for your contribution, Shauna.
The least I can do. I do have one question, Rick, about the hotel occupancy taxes that we have not received, and was wondering if there was any further conversation on that.
We have a meeting, Jason and Lisa Schott, Drew and I have a meeting at the end of this week to discuss how we're going to move forward on that. But I based on what the comments made at the GEO meeting, we've gone ahead and invoiced and billed all those hotels in the month of May, because when I reported to the committee, they seemed to be dismayed that we had not done that like we normally would do under normal operating procedures. So I went back to Lisa, and we have invoiced and sent those late payers out an actual bill for that last period, that first quarter period. But as far as going forward and steps to take, we're going to be sitting down with Jason and looking at that very closely later this week.
It's great. Thank you.
Thank you, Rick. Thanks for the question, Shauna. Henry?
Yes, Rick. Since you guys did such a good job at predicting the April, March numbers, have you done anything to predict the next month?
Back to you, Jason.
Next month, yes. We have predicted next month. Actually, it would be May's sales tax for April's sales. Right. It's worse. So I'll leave it at that. It's not better because you've been shut down for a whole month of April where March wasn't a whole month.
Yeah.
Right. Well, but can we know what they are, what the numbers are?
Yeah, I'll have to send, I don't have it in front of me. It's like in the mid 30s in terms of negative. So, but I am going to update it based on some surveying information that that's done on a monthly basis. So we'll probably get to it in the next few days. I'll send out what we project for May.
Okay, thanks.
Thank you.
You'll have to buy some more butter churns online and then we'll bring that up.
Yeah. While you're at it, I'll take the lottery numbers predicted. Martha?
Thank you, Leslie. Rick, we also had the hotel tax discussion in the budget committee. So I wondered,
I think I meant budget committee. I'm sorry.
Oh, okay.
I said Geo. I'm sorry. You're right.
Did have you reached out to folks like the chamber? Just let them know what.
Martha, you mind if I interrupt you there? Because
Sure.
what I heard is that there's going to be a meeting on Friday and maybe they'll have that conversation about who else.
Okay, right, but they did send an invoice. I just thought some more communication, including Nick Helmholt and the CVB, just so folks aren't blind, so those folks aren't necessarily blindsided about what's happening.
Right.
Right.
Okay.
Good idea.
Thank you.
Thank you. Shauna and Deborah, your hands are still up, or do you still need to speak? More butter churns? No, thank you. Appreciate it. I'm looking at the time. Why don't we take a quick break? I wanted to get through these guys. We don't have a lot on the agenda, so we're going to be crisp when we come back. Let's take a quick break and we'll be back here at 8 o'clock sharp.
You're on.
Okay. We are resuming. I need to know that legislators are there. Good, we have a quorum. Here we go. Resuming our meeting. Are there any other resolutions to be added or withdrawn from the agenda? No, don't see any. Moving on. Consent agenda. These are resolutions and appointments to be voted on as a group, unless any member of the legislature requested a resolution or appointment be instead included separately. The advisory board appointments. We have to the Health and Human Services Committee, Office for the Aging Advisory Committee, Carrie Shearer. Her term expires December 31, 2022. Said it was pending committee action on Monday. That went through in committee. Shauna, thank you for the nod. That is the only appointment I have. Rest of the consent agenda. Resolution A, under government operations, refund of taxes, Village of Cayuga Heights tax parcel 18-1-1.1 ID 93-119. Resolution B, resolution to update the administrative policy manual, policy 0246, equal employment opportunity, and policy 0315, military leave, ID 9317. I know that some of you had talked about not getting them. I hope you did get the other policy. Everyone is good. May I have someone move the consent agenda? Amanda, thank you. Seconded by Dave McKenna. Roll call, all in favor of consent agenda, appointment, and the resolutions A and B.
Amanda Champion,
Yes.
Deborah Dawson,
Yes.
Henry Grandison,
Yes.
Rich John,
Yes.
Anna Kellis,
Keep going.
Dan Klein,
Yes.
Ann Corman,
Yes.
Mike Lane,
Yes.
Dave McKenna,
Yes.
Glenn Maury,
Yes.
Martha Robertson,
Yeah, yes.
Mike Stigler,
Yes.
Shauna Black,
Yes.
Leslie McBean Clairborne,
Yes,
13 ayes, 0 noes.
thank you very much. Standing committee reports. Facilities and infrastructure, Mike Lane, Chair.
Thank you. We will be meeting again on Thursday at 9 a.m. That'll be a Zoom meeting, of course. And we will be talking about things like the RFP coming out of recycling and materials management, which is an important thing we're doing, which will contract for the next at least the next 5 years. And we'll also be taking up several airport resolutions.
Wonderful. Any questions to Mike? Thursday at 9. Yes, Martha.
Thank you, Leslie. Thanks, Mike. I saw that highway construction was the kind of thing that was in opening in phase 1, sort of allowed under phase 1. How is that affecting Jeff Smith's plans? You know, what kind of work is he going to try to do this summer?
Well, remember that based on the recommendation of the county administrator, the construction for the season has been sharply curtailed to some of the projects that we had planned may not happen this year. So I would defer certainly to Jason, but that's my understanding at this point. We're going to have a pared down construction season, not season, but construction activity.
Is maybe if Jason can chime in, is that because of watching our budget, or I mean, I guess it sounds like the state is lifting the prohibition because of social distancing and the pandemic. So that slowdown is because of our budget.
Yeah, it was more of a budget decision than, I mean, they could still continue to, construction was always an essential service that was continued. So we're continuing with the state jobs and federal jobs that are projects that are funded, but it was really a budget decision to lay off, or I'm sorry, furlough the highway staff for an extended period of time in the middle of the construction season, and then also reduce some of the work this year that will have some material savings. So, you know, we talked to Jeff about, you know, prioritizing critical assets that needed to be improved this year versus ones that could be put off till next year, and that's how we went about it. So it was a budgetary decision. Some communities have taken different approaches. They have not done that. You know, I think it was more prudent to do that, but that was, you know, that was a budgetary call.
Thank you.
Yeah.
All right, Henry.
Yes, Mike, I saw that the Freeze Road project is done. Can you comment on that?
The Freeze Road project is done? You mean it's not done?
Well, no, but the process of deciding has been done?
The town has picked a one-lane option and has sent it off to the state. Whether the state will end up approving that or not is still up in the air at this point. So it's the kind of thing that you just have to keep staying tuned to.
In terms of the liability, does the county take on more liability by it being one lane?
I don't think so. We have a number of one-lane bridges throughout the county. As long as they are built substantially to carry unlimited loads, I don't see that being an issue. Anyone can look at things like sidewalks and the narrowness of a one-lane bridge, but I don't think there's any additional liability if the bridge is built properly.
Okay, thank you. Martha? Okay. You just forgot to unhand yourself. Got it. Henry, are you done? Okay. Government Operations Committee, Amanda Champion, Chair.
Thank you, Leslyn. So I don't usually talk a lot in meetings, but I have quite a few things to report on tonight, so you'll have patience as I go through them all. Government Operations met about a week and a half ago, and we covered a lot of things. One thing was we had Elizabeth Cree and Stephen DeWitt there from the Board of Elections. They gave us just a brief update that absentee ballots at that time were going out very soon to all voters in the county. And actually, I just got mine today, and it says stay home and stay healthy. And so every voter will get this, and you need to fill it out. You're not going to be mailed automatically a ballot. This is how you get a ballot. So look for this in your mail and fill it out by June. Well, they have to be received back to the Board of Elections by June 16th. So everyone out there who's listening, that's an important thing.
Amanda, may I just ask a quick clarification?
Sure.
So what you just held up, we get, and that's what we use to request an absentee ballot?
Yes.
Okay, so that's not our ballot. We then have to send that in to request an absentee ballot, and then we have to vote using the absentee ballot.
Correct.
Thank you.
It's also a self-mailer too.
Yeah.
It's also what?
It does have, it is postage paid, so you don't have to put your own stamp on it.
Thank you.
Okay, we also had a report from Annette Birdsall from Tompkins County Public Library. And she gave a really thoughtful and thorough report. Many of you were at the GO meeting, but for folks who are listening, they, like a lot of organizations, are being hit pretty hard financially. As you know, the county will not be giving them 25% of their third quarter normal allotment, and it's highly possible that they also won't get 25% of their fourth quarter allotment. So that's a problem. The Library Foundation, which is their main fundraising organization, it's based on philanthropy, and there's not as much philanthropy happening right now, so they're not able to raise as much money. Very sadly, personally for me, is that the book sale did not happen in May, and that is a major funding portion for the library. The Friends of the Library are like everyone, trying to figure out what the book sale is going to look like. The book sale is a wonderful thing because you go in and just look at row after row of books, and there is no social distancing there. So it's going to be really difficult for them to figure out how that's going to work. So that's a challenge. So, they also aren't sure if they're going to be getting they're going to be getting a significantly reduced amount of money from the city of Ithaca as well, because their contributions are based on sales tax, which, as we know, are down. So despite all of that, there are a lot of challenges, but Annette is doing a great job. The staff is doing a great job. As Jason said, they're looking at how to reopen and what their process is like. They've really been thinking through what that will look like for the community. So it was a really great update. Folks can go back and watch that on GEO. It was right at the beginning of the meeting. So that's from the library. So the other topic was Greg Potter from the IT department just gave us a real brief update on the website. So as you may recall, there have been for a couple of years trying to get update to the website. As COVID hit, they were just about to launch some new pages and really take the next steps. That kind of got put on hold, but even so, in the midst of it all, Greg and his team have actually launched 17 new department pages. So for example, if you go to the County Office for the Aging page, it's all updated, it's much more readable, things that have shifted around. I'm sure there's many more updates that need to happen, but even in the midst of everything else, they've managed to get, some departments updated on the website, which is really great and very much appreciated. So before I go on to the next topic, I was just going to see if there was any questions on those topics.
And
Thank you. So I have my ballot here, or I'm sorry, my application for an absentee ballot. And can you please remind us, Amanda, what reason they recommend requesting one? Is it temporary illness?
It's temporary illness, or it's valid to say that you are afraid of contracting COVID-19.
There's no checkbox for that. It's
just
a checkbox.
Yep.
So temporary disability, I guess, or illness?
Temporary illness, yes.
Okay, thank you.
Yep.
all right, thank you, Annie. Henry?
Also want to mention that there will be a presidential primary in New York that the court decided today, and that the state has withdrawn their appeals.
Okay, thank you for that update.
Great.
All right, go ahead, Amanda.
Okay, so the big issue that we talked about was redistricting and the census information. And we have talked about this a couple times at GO. I know there's been lots of individual conversations. I think this might be the first time that we're really talking about it at a full legislature meeting. So I thought I would kind of go through and talk about the issue, some options, and process for folks listening. And so this is recorded, and anybody in the future can come back and look at, listen to the details. So bear with me as I kind of try to spell it all out. So every 10 years, when the census data comes back, the county needs to look at that data and decide how much, or not decide, but assess how much the population has changed in Tompkins County. And if legislative lines need to move from this side of my house to that side of my house. It's based on population and the numbers. So the issue that can come up is the timing of when the legislature has their elections and when we get the census data back. This year, the way that it's going to kind of work out is that we will be having anyone who wants to run for the legislature in 2021 will need to decide if they're going to do that, and petitioning will be happening in beginning in February of 2021. As it stands right now, we won't have our census data back. We won't have the process of the independent redistricting commission done until late 2021 or even 2022. So that doesn't really work out with our election. So no matter what happens, just to put this out there, no matter what happens, there will be a redistricting commission that will be appointed or formed by the chair. It usually has community members, it's independent, it does not involve legislators, or it should not involve legislators. And they will look at the district lines and they will make their decisions, and that will happen. When exactly that will happen is unknown. So just to put that out there, and also just to put it out there that we are not voting on anything tonight. There's no resolution before us. This is part 2 of a 10-part conversation. So just to be clear about that. So there's an incongruency with people beginning the election cycle next year and when we will get the census data back. So that has sparked lots of conversation. And I'll just sort of run down some of the options that we have talked about. There is an option for weighted voting. So based on what the population changes are in 2022, different legislators would have a different weight of, or percentage of their vote on the legislature. I believe this has happened in the past. It is certainly a possibility. We could switch the legislative terms entirely to 2 years. So every 2 years we have another election. There's plenty of other counties that do it that way. We could also in 2021 hold a short term, either a 1-year or a 2-year or a 3-year term, to give enough time for the census data to come back and the redistricting process to happen. So let's say in 2021, we don't run for a 4-year term again, we run for a 2-year term, then returning to a 4-year term. So again, it's a very complex issue. So for if anybody's listening at home, I'm sure any of us are happy to talk more and answer questions. There was also a suggestion of switching entirely to 5-year terms. And that's a possibility that would actually kind of shift the whole situation, and we would be elected, or legislators would be elected every 5 years. And that would kind of negate the census data. It would kind of put us offset. There's also the option of maintaining our current election cycle this time around, and deciding not to change our terms and just going forward for a 4-year term next year. So that's kind of, those are the numerous options. I think we had about 7 options that folks were talking about. I wanted to say that it is very complex. I would recommend, and I would hope that each of the current legislators would not be looking at these options based on what you personally want. I think that it does impact the county, the residents, it does impact anybody else who wants to run for office. There's many of us on this Zoom call who may not know if we're going to run for a legislative seat next year. And so I hope that folks think about it in terms of the bigger picture, not just what might work for you. Let's see, as I said, the redistricting commission will happen no matter what. So there's kind of the main thing that we're talking about is our election terms. So a little bit about the process. So at the GO meeting 10 days ago, we did talk about the process. Leslyn and I also met with Jonathan Wood, the county attorney, as well as Kathy Covert, county clerk, legislature clerk, to discuss the process. So what we did at GO was try to narrow down these 7 options into 2 options. There were some that people liked a lot more, some that had no support at all. So what we narrowed it down to pretty much almost unanimously was to maintain our current election cycle, meaning that in 2021, we would the elections would be for 4 years. So and then the next election would be in 2025. The redistricting commission would still happen during that time. The other option that we narrowed it down to was that in 2021, we would have a 2-year term, meaning that in 2023, there would be another election, and that one would be for 4 years. One note about that option is that, as opposed to some of the other options, is that it does keep the county legislature elections in line with the local town elections, which would happen on those same years. So, so in terms of the process going forward, at the next GO committee meeting, which will be on June 4th at 1:45, the committee will be discussing this further. You're all welcome to come and talk more about it. If the committee, we will have a vote. If the committee decides with option number 1, which is to maintain our current election cycle, if that's the vote, then there will be no more discussion at the committee level. That will be because there's nothing else to do in terms of election cycle. If the committee decides on number 2, which is the 2-year term, or if an individual legislator wants to bring another option forward as a member filed resolution, that's another possibility. So if we do want to go with option 2, we will vote on that on June 4th, and then that would go to the full legislature on June 16th. So June 16th would be the time either for a member filed resolution or for the committee's resolution to come forward. At that meeting, we would then discuss the topic again. and there would be a vote to move that forward. There would be a vote to say, yes, this is the direction that the legislature wants to go. If that passes, then we will turn to the county attorney to draft a local law. Ideally, he'd be able to do that within a couple of weeks, and we would need to have a public hearing in early July to get public input on this. After the public hearing, we would need to have another vote to I guess it's not really to implement it, but to get this put on the ballot. So even no matter what we decide, it still has to go onto the ballot, and voters have to vote on this in the fall. So if that's the route we go, we have numerous more opportunities to discuss this. And if things move along, as I've sort of outlined, we should have enough time to get something on the ballot by, I think it's the 1st or 2nd week of August. So Rich, John, Mike Sigler, and I wrote an op-ed, which you can read in Tompkins Weekly. We tried to kind of spell this out as clearly as possible. Our communications director, Dominic Recchio, is also working on some further publicity about this. And Henry and I have both reached out to various city officials to try to understand what they're doing in terms of redistricting and if they're thinking about it yet. I kind of have to imagine that this topic, while important, is maybe not on the top of everyone's list. But it is an important issue. It's one that we at the legislature are taking seriously. But I also want to say, you know, there's no one right answer. There's no one right way to do it. We all have an opinion. I'm sure we all have gone back and forth between various choices, various options that we think would be good. I just want folks to remember that, you know, it's important, but if the lines are off for a year or two, or even 3 years, as one of Henry's constituents said, it will not be the demise of democracy. It will be okay if things don't turn out exactly the way that you personally might not want it to go. And I do hope that as folks talk about this, I know there's a lot of opinions that we can remember that and remember to be really respectful as we discuss. So I think that's pretty much it. I know there's a lot to say. Leslyn, I turn it over to you to go forward.
I was just about to adjourn the meeting, but I was looking for my gavel so I can hit meeting adjourned. Thank you, Amanda, for that very thorough representation of what came from the committee meeting, as well as other meetings, and understanding how we move forward with this process. You're right. It's not a very easy thing. Every time we have to do this, it's wiggly, and you know, it's not a straight line by any means. And so I'll open it up for conversation. There are any number of options. Like you said, we started with 7, and you know, we're trying to figure out what will be, you know, best for all of us, for our constituents, for the county as a whole. So Henry, I see your hand up. Did you have your hand up, or you just forgot to take it down? Okay, you just forgot to take it down. All right, discussion.
Okay. Nobody wants to talk. Nobody wants to talk.
Nice try, Amanda. Mike Lane.
I just want to point out that 10 years ago, when we first implemented the independent commission, it worked really well. And we kept the politics out of it, which was a good thing. And so we want to facilitate that to happen again this time. We know last time there was a big issue. In fact, the last 2 times, the big issue was how many legislators was the city of Ithaca entitled to. And after 2000, there were 5 city legislators, but the districts had to go outside the city in order to capture enough population. After the 2010 census, there were 4 legislators recommended, and they were able to stay within the boundaries of the city. So we have to make sure that we know that. There's been a lot of construction that's happened in the city of Ithaca, and we may see a larger population than we had in 2010 in the city. They might be entitled to 5 legislators again if we stay with the same number, or we can also change the number of legislators. When I say we, I mean the commission can recommend that, and we could go down to 13. We could go up to 17, although I don't think we'd have enough chairs around the dais in the legislature to make all those happen. But that's something that's got to be looked at. In 2010, it was the county's redistricting commission that took the lead, and a lot of it was held up by wanting the city to make some decisions, and their redistricting commission was quite a ways behind the counties. So we have to watch out for that too. So those are just some of the things I think it's important to think about. Weighted voting, I think if we go 4 years without changing our terms, I think to be fair, we would have to go to weighted voting. Thank you.
Thank you, Mike. Other comments? Martha?
Thank you, Leslie, and thank you for that long explanation and good explanation, Amanda. A couple of questions to clarify. We set up a schedule for August where we were canceling the August 4th legislature meeting. Is that, I guess, it's a Kathy or an Amanda question, right?
Yes.
Working backwards in order to get something on the ballot, and again, if we don't change the length of the next legislature term, we don't need any local law. But if the 2021 election is for either a 1, 2, or 3 year term, we do need a local law. So maybe it's a Jonathan question. Do we have to pass it out of the legislature, pass the local law? When, Jonathan?
Well, yes, you have to pass the local law. I don't remember the dates. We had asked the Board of Elections to do us a memo on the dates, and I don't remember them exactly, but we do have that. I think we're still good in the 2nd August meeting. I'm pretty sure of that. But I don't have the dates with me, but we did ask the Board of Elections to give us those dates, and they did.
Okay, so we do need to.
Yeah, and I would just also throw out there, I mean, I think if it does go forward, the June 16th meeting, if at the June 16th meeting, it goes forward, the first meeting in July, we could have a public hearing. I mean, maybe that's too soon, but ideally we could. And then the second meeting of July could be the vote, and still have time in August. Dan, I think, had also brought up the idea or the topic of, that first August meeting. And I mean, I don't know if folks feel like we would need to put that back on, or if that's a whole nother process that we have to consider. I guess Jonathan would know better than me how long it would take to do the local law, have the public hearing, and get it back to the Board of Elections. But
okay,
it seems like we have enough time.
Let me have Martha finish her questions and thoughts.
Yeah,
Thanks,
thank you.
Amanda.
Just to make sure that we don't lose track of that, but also the public can certainly weigh in now. They can weigh in at any of our alleged meetings, or online, etc., and look for that op-ed, and I hope Dominic will get some other stuff out. I was curious about TCOG. Has this come up at TCOG? Just Shauna, you're the rep, and because this does relate certainly to their, in addition to this, the very clear relationship with city wards, they may have an opinion about when the elections happen. Has this come up at TCOG?
I have only been appointed for one meeting and it has not come up. No.
Okay, I would hope somebody, and whoever, somebody would be great if TCOG could get that on their agenda so folks have a chance to understand what the.
Maybe what we can do as well is invite Amanda to TCOG to explain, if that's all right with you, Amanda.
I didn't want to clearly, tell Amanda but yeah.
No, that's fine. And Jason
asked
and
her.
I had been trying to connect, and I think maybe this was what he wanted to connect with me about TCOG. Yeah, okay.
Okay, thumbs up, TCOG, it'll happen, got it.
Okay, great. I appreciate that. All right, it's an important issue. Oh, I know one other thing about the census, and I don't know if Mike Lane has any more latest information on when we really expect we might get the census data.
Are you asking him?
Yeah.
Yeah, I'm asking Mike.
I
If
was going to talk about it on Census Committee, but I'll say it now. I've inquired of the census representatives, and the word we have back on the revised schedule is we should have the block data by June 30th of 2021 at the latest.
Okay. Thank you.
Thanks, Mike, and thank you for already giving your census report. I'm messing with you. Anything else? Yeah, Rich John, and then Amanda, I'll get back. Oh, sorry. You know what? I apologize. Amanda, if you have something quick to say, go ahead, because Dan has been here waving in front of me, and I keep looking at the screen and missing him. He's in chambers.
Just that Henry had sent around an email, and I also looked at the census website. The census website says July 31st, we would get back data. So either Mike Kaplinka-Lair's dates were off, or there's still some confusion or something. So just putting that out there.
All right, thank you.
I'll try to clarify.
All right, Dan, and then Rich.
Thank you. I have Jonathan's memo from a year ago or so from Government Operations Committee, and I had written in myself, so I can't be, I believe it's accurate. It says the deadline for the ballot to the Board of Elections is August 3rd. So we have to finish our business if we're going to make any changes in July.
So, actually, I think, Dan, that might have been for last year.
Oh, okay.
I'm pretty sure that was for last year, and then we asked them again for this year, because at the time, I believe Mike Lane was chair, wanted to see if we can put it in last year.
I think you're right, so I can stop carrying this around now.
Yeah.
Okay, a couple other things I did want to say. 2010 Independent Redistricting Commission. As far as I know, we were the only independent redistricting commission in New York State.
Yep.
So, everyone's praising Tompkins County. Let's praise ourselves again for that one. The one other thing I wanted to say is that it's been brought up a couple of times that we need to take into account the city and the city wards. And while certainly the city should have access to this conversation and offer input, as I think it through, I don't really think it matters, because we're not discussing redistricting yet. We are discussing the length of our terms. And when we get to redistricting, that's the time that the city can make a decision, the city and the county can make a decision that we want the county reps in the city and the city wards to align. But that discussion is going to happen after redistricting. The length of the terms that we are discussing for ourselves right now has nothing to do with that at all. So either those possibility of the city wards and the county reps aligning will happen in 2023, or it'll happen in 2025, or it won't happen at all. But that decision cannot be made until after the election and after redistricting happens. Thanks.
Thank you, Dan. You don't talk a lot, but when you talk, there's a lot of wisdom.
Thanks.
Unlike that Amanda who just talked a lot tonight. Rich John?
Thank you, Leslin. I'll try to get up to Dan's level. The block data, whether it comes in June or the end of July next year, Mike, could you just go into a little bit of detail of how long it's going to take for the redistricting commission to process that block basic data into a redistricting proposal in time for a 2022 primary season? Would that work?
I think it will. We might even want to ask Greg Potter about that, since he staffed the 2000 and 2010 commissions. And but I think it can be done in a few months. That's what was actually done. I think it took longer than it needed to in 2010 because they were waiting for the city for quite a long time. Greg, is that right?
Yeah, I think a good estimate from the start to the end of the redistricting process is about 4 months, Mike.
Okay, thank you.
Anything else, Rich?
No, that's it. Thank you.
Wonderful. Thank you. Martha? Oh, wait, Martha, hold on. I'm sorry. I had Annie.
Thank you. Thank you, Leslin. So I had just wanted to mention, and then I had a question. I wanted to mention something about that there could be serious issues with the accuracy of the census, which I realize there's really nothing that we can do about that, but we have to go by what the census says. And my question is, and possibly this was mentioned when Mike Lane was talking, but what did the county do 20 years ago?
Actually, the Government Operations Committee served as the redistricting committee. And that was staffed by Greg Potter as well. And that was the first time that we had, and Greg brought us a software program that really facilitated it. And we got it done in what, 3 months, I think, at that time. But we did not have an independent commission in place.
And the terms weren't changed?
No, there was no change in the terms. But what has changed since then is not the timing of the elections, but the timing of the election calendar, moving back the time that you begin petitioning to January, February, as opposed to July, for example.
Thank you.
All right, Martha?
Thanks so much. I wanted to just mention, Dan, I think the issue with the city was not, I mean, it's important that they're aware because they're the only municipality that also does geographic districts within the municipality. The issue was more that the longer that we're living with data that are sort of the districts that are out of whack of the latest data, then you have to look at where's the impact, and our suspicion is because of all the construction in the city that's likely to undercount, disadvantage the city. We have, I mean, Mike has talked about this a number of times where in 2000, the city kind of had the population for about 4.6 legislators. In 2010, they had the population for about 4.4 legislators. So in 2010, we rounded up, 2010, we rounded down. So it's such a close, it has been such a close issue in the past 20 years. And then with seeing so much construction, that's where the sort of disproportionate concern by the city might might be relevant. And that's where the length of terms matters, not really about their wards. So I just wanted to comment on your thought. And I think that the issue of bringing TCOG into this is that an issue that you've raised about putting our elections in the same year as town elections, and the impact of having people run together as a ticket within a municipality, that, or having the turnout be increased if they're put together. So just wanted to comment on that.
Thank you. Henry, wrap it up.
Yes. I mean, my concern is that, the college students, that they're not going to be accurately counted. I mean, we know from the websites that they have a low turnout, and plus with the whole shutdown period, I don't know how many people have been unknowing that they can answer the census for where they came from, not where they live currently. And so I don't know. I mean, I don't know how that cuts, but maybe that will undercut the census data that we have anyway. And so, what's the impact of that? I'd also want to talk to Mike Lane. Do you know when the deadline is for people to submit the census? I mean, is it the end of the year, or is it some other point in time?
I believe it's something like the end of August. I'm not sure the exact date.
Yeah, that's what I thought too, which means that all the Cornell students who were there had to do it before they come back.
It may have been pushed over further, but I can inquire about that for you, Henry, as well.
Yeah, I think I saw on the website last night that it was the end of August. And so I just really wonder, basically on historical numbers, whether Greg Potter can see whether or not Cornell is in fact way under.
Well, we do know that where a lot of the graduate housing and the Cornell student housing off campus was severely probably undercounted in 2010. And it's likely to happen again, but that's why we're continuing the efforts to try to get people to understand how important it is to fill that census out correctly, or to correct it if they have placed themselves in the wrong locale, because students, if they're going to school here, are to be counted here under the census rules.
Indeed. Thank you, Mike. Anything else, Henry? All right. Well, there's still more conversation to happen with this. Amanda, any last thoughts to close it out?
No, I appreciate everyone's opinions, and yeah, we will talk about this again at GO, and the committee will be making a decision on June 4th.
What time is GO on June 4th?
1:45.
June 4th at 1:45, and you have options to think about, and please share with Amanda if you can't make the meeting, with Amanda's chair of the committee or any of the committee members, your thoughts about the options, so they can be included in the discussion. Okay, thank you all very much. Thank you, Amanda. Moving on to Planning, Energy and Environmental Quality Committee, Deborah Dawson, Chair.
Thank you, Madam Chair. I'm afraid I'm pretty boring after that discussion. We will be meeting on Tuesday, the 26th at 10:30 in the morning. There is not much on our agenda. We will have an update on the progress of the fee and dividend bill. I'm looking forward to climate and the environment becoming important again at some point. I would remind everyone that climate change is not slowing down just because we have a COVID-19 epidemic. So don't forget that what we do on that score continues to be very important. Thank you.
Thank you, Deborah. Any questions for Deborah? And you meet Tuesday at what time?
10:30 a.m., Leslie.
10:30 a.m. All right, tune in if you want to talk climate and environment. Riveting discussion it will be. All right, moving on, Budget, Capital, and Personnel Committee, Martha Robertson, Chair.
Thank you, Leslie. We met on May 11th, and as I mentioned before, we, among other things, talked about the hotel tax issue. Had, as usual, a really cheery summary from Jason and a really also up one from Rick. So we, and I will say that the we had talked about possibly a special meeting to talk about retirement options, and that got put off. So we're going to be having that discussion about options from Lisa and Jason for new retirement policies, for retirement incentive, June 8th. That's our next meeting is Monday, June 8th at 3 o'clock. So that will be a main topic of that discussion, but I'm sure not the only topic. On May 11th, we also did talk at some length with Lisa about the furloughs that she and Jason and department heads had really worked through with staff. About a third of our employees who were furloughed did cash out on their accruals so that they could kind of make it through through this period. So that's an indication of some folks really being kind of, you might say, on on a financial edge if they had to do that. We also talked about having another expanded budget committee meeting for the whole legislature to really dive into what 2021 is going to look like, and have come up with June 30th, Tuesday, June 30th, 5:30 to 8:30, and ran that by everybody and by the staff. So we're putting that into, Kathy's setting that up as an expanded budget committee for that night. And I'm just sort of estimating 5:30 to 8:30. That's probably as long as we could stand to talk about this, but we might actually need 3 whole hours. So that is the report from the budget committee. I will just mention, I got an email from Jason this afternoon. We've all been breathlessly waiting for the governor to make his budget adjustments as he negotiated the authority to do this year. If you remember, as of April 30th, he had the authority to actually make any kind of cuts he needed in the state budget. We've been waiting, haven't heard any news. Jason sent me a message, and Jason, fill in anything else you want to add, but it looks like from NISAC, they're expecting to hear in early June, waiting to see that Cuomo is waiting to see what happens with the federal stimulus bill, the next bill that would be coming out, whether state and local aid will be included. Jason, is it okay if I mention that conspiracy theory? I kind of like that one.
Yeah.
All right. A direct quote, a conspiracy theory is that the governor is waiting till after June 3rd to announce cuts because the legislature is scheduled to end their session June 2nd. The legislature did negotiate that they would have the authority to 10 days after he proposes budget cuts to make adjustments in that plan. So that sounds like a pretty astute hypothesis from NISAC. So it looks really, really terrible. He also can make cuts retroactive to April 1st, as long as payments haven't actually gone to us. So I think we're doing the right things so far to try to save wherever we can, because it looks like we're going to need it. Jason, do you want to please add in anything else that you've learned?
I have nothing else to add right now. You captured it all.
Okay.
I think it's good.
Thank you. So if there are no questions, that's all I got.
Any questions to Martha? Thank you, Martha.
Thank you.
Okay, moving on. Stay tuned. Workforce Diversity and Inclusion Committee and Corman Chair.
Thank you, Leslyn. We haven't met since last meeting. We're going to meet again next Wednesday at 3:30 And some of the topics we'll be talking about are how the virus is impacting communities of color, looking at Pride Month proclamation for June for the LGBTQ community, and diversity hires, and a report from our Human Rights Office, Dr. Clark, on outreach efforts. So please tune in.
All right. Thank you, Ann. Henry, your hand is going in and out and in and out. Are you up or are you? I take it you're not. Okay. All right. And you're meeting next Wednesday, you said, Annie?
Yes, next Wednesday, the 27th at 3:30.
Okay. Thank you, Muchly. Tompkins Intergovernmental Relations Committee, Martha Robertson.
Thank you, Leslin. We met on May 6th, our first meeting. And it was, I thought, very informative. We were able to get Amanda Spellacy from Chuck Schumer's office on the phone for about 40 minutes. We also had joining us Diane Miller, who is Cornell's public governmental relations person in Washington, D.C., and Charlie Krasansky, Cornell's person from Albany. And both Charlie and Diane said that they would like to in the future have a slot on the agenda, and they'll get the distribution, our minutes and everything are on the distribution list. So we hope we'll be able to hear from them on a regular basis. I've also asked that our next meeting is June 3rd at 11:30. I've asked that at Deborah's suggestion that TCOG be included. If this is intergovernmental, then we don't have to just look to bigger governments, but we can look to smaller ones. And Shauna said that she would be happy to do a TCOG report on a regular basis in the Tiger meetings. So I am, we keep trying to track what's going on in the federal and state arenas. I would really urge folks to sign up on the NACO. Now that we're members of NACO, the National Association of Counties, sign up to get their emails, and they've got a lot of updates. They're doing a lot of analysis. I was able to have a call with a couple of their staff, along with some NISAC staff last Friday, to get a little bit more background on what's going on with the federal legislation. They're a really great resource. And and they sent out a comparison of the two federal bills that as I mentioned before, the HEROES Act and the SMART Act. And I'll send that around to everybody. This is really an important time for us to try to organize and help educate the public and take action on these issues. So I really appreciate everybody's interest and participation. I hope we'll have a chance on June 3rd to talk about our committee goals. That's what I have at the moment.
Great, thank you. Any questions to Martha? No, all right. Moving on. Everybody is falling out at this point. Housing and Economic Development Committee. I know Anna Kellis had to jump off the meeting. And so Vice Chair, Mike Sigler, is that you?
Hi, it's me. Yeah, Anna had to step out. I really don't have anything to report. Our next meeting is Thursday, 9:30. So if you'd like to come by, Thursday at 9:30.
Thursday at 9:30. The following Thursday, not 2 days from today, but next week, Thursday.
That's right, the 28th.
28th. Thank you, Mike Sigler. Any questions? All right. And the resolutions were already passed. Complete Census Count Committee, Mike Lane, anything left?
Just a couple of short items. One that, according to administration, Amy and Nick, still no movement from the state on the money they thought they were going to give us for helping us advertise the census, and either through nonprofits or directly. That was $130,000, which we were told we were going to get last fall. nothing's happened with that. We probably will never get it. That's my guess at this point. We are working, I met via phone with Amy and Jason about the possibility of needing some money for the advertising effort once we get open up again. Jason has assigned Dominic Recchio to work up an advertising budget to help us through the period of between the time we open and certainly August 31st or whatever the drop dead date is for this. I did want to mention that Pat Pryor, who served as a legislator in the past and who has most recently been the chair of our Public Information Advisory Board, has felt that she could not do the job as much as she wanted because of some health issues. And so she has tendered her resignation. So that board will have to be reconstituting itself in the near future. Those are the things I wanted to mention.
Thank you, Mike. And I have a sneaking suspicion you're right about the $130,000. Any questions to Mike? Thanks everyone for continuing to push out the word about filling out the census. It's really important. Downtown Facilities Committee, Dave, you got anything for us?
No, Leslie, Downtown Facilities has not met, and I don't anticipate a meeting this month either. So that's my report.
Thank you. I just wanted to hear your voice. Public Safety Committee, Rich John.
Thank you, Leslie. The Public Safety Committee will be meeting this Thursday, the 21st at 3 o'clock on Zoom. And the principal item we'll be talking about is receiving the Labella existing conditions study on the jail and the public safety building, which will start a very long discussion, I imagine, on what do we do about it, because it's pretty clear we need to do something about that building. What that is, well, we'll see. The other item I wanted to mention is the jail population, which is at an extraordinarily low number. I believe it's a record. We're at 27 inmates. One of those is a board in from another county. So we're really at a local number of 26. And I would also note that 9 of the people in our jail are on parole violations. Now, some of them might be on parole violations for significant matters, but they can also be there and often are on what are called technical violations, which may not even be crimes. It could be missing a meeting, an appointment, not going to a job interview, failing a drug test, something that you certainly don't want to see a parolee do or not do, but they're not crimes. And we have worked really hard to reduce our jail population as far as we can because of the COVID-19 situation. And we've seen really nothing from the parole board to parallel that, which I just don't understand that there hasn't been a similar effort there. They're also not moving inmates that are what are called state ready to state prisons after they have a hearing. They're just continuing to hold them in the local jails. And it's my understanding this is happening at county jails across the state.
Yep.
So I just point that out. I don't see that as good policy, state policy. But at any rate, we'll be meeting Thursday. I welcome any or all to attend.
Thank you, Rich. Any questions to Rich? All right. Thank you. Health and Human Services Committee, Shauna Black, Chair.
Thank you very much, Leslie. We had our meeting yesterday and we had an update on COVID-19 by Frank and Jason. We also had an update on testing in the senior living and skilled nursing facilities. It was nice to hear that over half of the population had been tested in our county. The meeting ended in a record 57 minutes, which has never happened since I've been on the HHS committee. And our next meeting will be June 15th. You all are welcome to join.
Thank you, Shauna. Any questions for Shauna? Okay. No individual member filed minutes of the previous meeting. Moved by Amanda Champion, seconded by Deborah Dawson. Discussion? Any changes, corrections, deletions? No? Okay, roll call vote on the minutes.
Leslin, I did send a change to Kathy. I copied everyone on it, though.
Kathy is giving me the look, which means she didn't get it.
Really?
No.
Oh, well, then don't worry about it. It's fine. We can just go forward with my disdain on the record.
You can forward it to me if you'd like.
Okay, I'll do that.
All right, Deborah, I love the laugh. Roll call.
Amanda Champion,
Yes.
Deborah Dawson,
Yes.
Henry Granison,
Yes.
Rich John,
Yes.
Dan Klein,
Yes.
Ann Corman,
Yes.
Mike Lane,
Yes.
Dave McKenna,
Yes.
Glenn Maury,
Yes.
Martha Robertson.
Yes, but can I just slip in? I'm glad that Jonathan Wood isn't cheating and he's not going to a hair salon. I just had to notice that. Jonathan has, it looks like 1960s hair.
All right, Martha, roll call vote.
Yes, on the minutes.
Mike Sigler,
Yes.
Shauna Black,
Yes.
Leslyn McBean Clairborne.
Yes.
13 ayes, 0 noes.
And Anna Kellis absent. All right, thank you all very much. The minutes passed unanimously. Any unfinished business? Motion to adjourn by Dave McKenna, seconded by Rich John. Everyone in favor of adjourning? Wave. Yeah, thumbs up, great. We are officially adjourned. Thank you all very much. See you next time.